Hi, everyone, and welcome to Sounding the Call COVID Science and Practice Symposium, presented by Doctors for COVID Ethics and hosted by UK Column. I'm independent journalist Taylor Hudak. From the very beginning, Doctors for COVID Ethics have been warning the public that the gene-based COVID vaccines would cause blood clots and autoimmunity. In this evening's first session, led by Dr. Michael Palmer, we welcome guests Professor Arne Burkhardt and Dr. Karsten Stumke. Dr. Burkhardt and Dr. Stumke will show us evidence of blood clotting and autoimmunity in both autopsy materials from patients who died shortly after vaccination and in living patients. Their findings are clear and cannot be ignored by the medical community or the public. Now, given that there are few health benefits of the government measures adopted since March 2020, many have been warning that the restrictive measures have been aimed at consolidating wealth and power globally. For instance, vaccine passports could be used together with central bank digital currencies to achieve total control of people, their transactions, travel, labor, finances, and assets, thus ending human liberty in the West if we permit it. So in this evening's second session, led by Catherine Austin Fitz, we welcome guests, Dr. Michael Yeadon, entrepreneur, pharmacologist, and former Pfizer executive, Robert F. Kennedy Jr., chair of Children's Health Defense, Dr. Piers Robinson, co-director of the Organization for Propaganda Studies, and Brian Garish, publisher of UK Column and former Royal Navy officer. Now, in the third and final session of the evening, led by Patrick Henningsen, we will focus on the broader issues of justice with an overview of the legal landscape. You will hear from guests Mary Holland, president of Children's Health Defense, as well as Dr. Meryl Nass, MD, Renata Holdseisen, a lawyer who is fighting against corona measures, Philip Cruz, a Swiss attorney, and Astrid Streckelberger, an international health scientist. And at the conclusion of today's event, we wrap up tonight's symposium with remarks from Dr. Sutrit Bhakdi and Dr. Michael Palmer. And once again, we want to thank you all for joining us this evening for this very special event hosted by Doctors for COVID Ethics. And we extend our gratitude and our thanks to UK Column for hosting this symposium. Also, please be sure to share this link with your friends and your family and all over your social media. I'm independent journalist Taylor Hudak. I want to thank you all for watching, and I will now hand it over to Dr. Sutrit Bhakdi.
Good evening, ladies and gentlemen, and welcome to today's symposium. We are not going to repeat things that we have said at the last symposium, because today is bringing the best and most important news that actually can decide the fate of the agenda. And the fate of this agenda is the end. Why? Now, without more ado, I am going to talk about three issues as an introduction. First, it is now known that the clinical trials which were used to justify vaccine authorization by Pfizer have been revealed to be fraudulent. In straightforward language, this means there is no evidence whatsoever for the efficacy of these gene-based vaccines in protecting against severe illness and death. It is known that the virus kills less healthy individuals and children than other respiratory pathogens, such as the flu, such as the pneumonia, bacteria, and so on and so forth, and that there is no real reason for emergency authorizing these vaccines. Now, the second point is, why then has this been done? And before we're going to take this point apart, let me tell you something that is very little known to anyone. Our immune system combats viruses via two armies. The two armies are the Navy and the Air Force. And the missiles they use, the weapons they use, are basically the same, but not identical. The first are antibodies that prevent the binding of the virus to the target cells. The second, however, are much more important, and they are the lymphocytes in your body that can recognize these viruses by virtue of what happens when a cell begins to build these viruses. The cell presents the virus on its surface, and these viruses are recognized by the lymphocytes. Now, what virtually no one has realized up to now is that there are two operational bases for the action of the immune system. One are the military barracks that is placed inside your body, which are mainly the lymph nodes and the spleen. Second, however, there are military barracks that are placed directly beneath the mucosal surfaces. These are the linings of your intestinal tract and respiratory tract. And what people don't realize is that the Navy is based in the lymph nodes, and the Air Force is based underneath the linings of your surfaces that contact the external world. And what people don't realize is that although both use antibodies to ward off viruses and lymphocytes that will kill the cells that making viruses, the fact is that whenever you inject anything into the internal part of your body, intramuscularly, and these are the vaccines that are being injected, they will only turn on the Navy in the lymph nodes, and they will send the antibodies out into the bloodstream and the lymphocytes into the bloodstream to combat the viruses which they think are in the bloodstream. However, they will not trigger the Air Force, and therefore those cells that are in the barracks beneath the surface of your respiratory tract will not be activated, and therefore they will not generate the antibodies that are needed to be secreted out through the linings of your airway to the surface of your mucosa, which contact the viruses. So in fact, all these vaccines cannot work, could never have worked, do not work, and will never work because the antibodies are on the wrong side of the wall and they are never secreted out to where they need to be used. So, bottom line, the vaccines could not work. And in fact, the CDC has openly admitted that these vaccines do not work because at the end of August, at a press conference, the CDC stated very clearly, and anyone can go and look at this, and said, the vaccinations do not prevent against the infection of the airways. And of course they can't. So if you're vaccinated, you are not protected against anything. And now, when we're talking about breakthrough infections by a mutant, it's not a breakthrough at all. It's just that there was never any protection anyway. So stop believing all these crooks and criminals who are lying to you. Now, I want to tell you that it is clear now that the benefit of any vaccination is obviously zero, because no vaccination gives you any protection against an infection, and because, second of all, this virus is less dangerous than the seasonal flu. So stop believing all those lies, guys. Now, if the benefit is zero, what is the risk? is there any substantial risk at all? We all know that the adverse effects to these vaccines are being reported day after day, and the lists are horrifying. However, we don't know whether they are true. Do these vaccines really cause damage? Can they cause damage in your body? Now, once this gene is injected into your muscles, you have to realize that it is going to the bloodstream. It will always reach the bloodstream. Anyone who says otherwise is lying to you. And once in the bloodstream, it is also, by the way, going to your lymph nodes, and it is going to invade the cells of the lymph nodes. Now, the cells of the lymph nodes and the cells that contact the bloodstream are going to make the spike protein. To put a long story short, any cell that dares to make this spike protein is going to be attacked by your immune system, because your immune system knows this virus, because the virus is related to the coronaviruses that have been around since the beginning of mankind. And your immune system just recognizes them, and the immune system is going to combat these cells. So in the lymph nodes, there's going to be a fraternal battle between the lymphocytes that are responsible for killing those cells that dare to produce viral protein, and the cells that do produce the viral protein. In the bloodstream, that gene is going to go to the linings of your vessel wall. The vessel wall is going to start producing these spike proteins. Imagine you sitting in, you are the bloodstream, you are looking at the tapestry on your wall, the tapestry is making the spike protein, it is ejecting into you, into your bloodstream, then the immune system is going to try to kill those cells. So after the first shot, within hours and a few days, the first arm of the immune system is going to scratch on those walls and try to remove those cells that are making the spike proteins. At the same time, the cells in the lymph nodes that are making the spike proteins are going to be destroyed. So when you do this a second time, everything is going to be much worse, because then the whole army of the immune system is going to come and try to shoot and destroy the vessel wall that is doing this. And then the gene is going to seep out of the vessel wall into your organs, into the liver, into the heart, into the spleen, whatever. And those cells are going to start making the spike protein. And the lymphocytes, the killer lymphocytes that patrol your body, see this, and they're going to go into these organs and try to destroy them. So what we have to fear is going to happen is that there's going to be a massive self-to-self attack of the immune system on a myriad of tissues and vessels that dare to produce the spike protein. And the lymphocytes are also going to be killed within their barracks because of the fraternal battle. And this will lead to immune deficiency, because the lymphocytes you have in the lymph nodes are responsible for killing tumor cells that arise all the time in your body, for keeping cells under control that dare to re-express viruses like the herpes virus, shingles, that are always coming out, but are suppressed by the lymphocytes that usually are there to protect you. So, to cut a long story short, we have to fear that horrible things are going to go on, that there's going to be a massive immune attack in all organs of your body. And now the question is, could this explain the myriad different symptoms and clinical presentations of adverse events, like, for instance, myocarditis, stroke, myocardial infarction, etc., etc., etc. And the question is, how would anyone be ever able to find out? Now, the politicians say, look, children, we're going to immunize you, we're going to vaccinate you. Don't worry. The vaccination, this shot is like a water pistol. We're going to shoot it at you and you will get wet. It won't hurt. Maybe if a drop gets into your eyes, it will burn a bit, but it will not get into your body and you won't die and you will be protected. Now, the latter lie is now exposed. No one is going to be protected. But the question is this a water pistol or is the pistol loaded? How can we find out if people who have died after vaccination really died because that pistol was loaded? And there's only one way to find out, and that is the way of the pathologist, the one person who will come and look at the person who has died after vaccination to see whether in the organs there are signs of self-to-self attack by killer lymphocytes in the body. Now, this has hardly ever been done in the world. One German pathologist and professor has done this over the last 4 months. Professor Arne Burkhardt, one of the most experienced pathologists in Germany, who worked for over 40 years and is still active, went to the trouble to perform biopsies and histology of people who died after vaccination. And he's now with us to tell us the most exciting thing that you will ever have heard in your life. I want to welcome Professor Arne Burkhardt now. Arne, thank you for being with us. Thank you for helping us in this dire situation.
Yes, thank you, Sucharit, and hello to everybody who is watching this presentation. Now, we had the chance to look at the organs of deceased people after the vaccination. We had, please, the first slide. We had all in all 15 patients that were where a postmortem was performed in institutes of legal medicine and in institutes of pathology. Now, these 15 persons are listed in these two tables. You can see they were 28 to 95 years old, 7 men, 8 women. They died between 7 days to 6 months post-injection, and you can see the kind of vaccination that was applied and the days that these people died after the vaccination. So next slide. Important was the fact where these people died. Because after a long treatment in the hospital with intensive medicine care, we have many alterations of the tissues and the organs that are not due to the underlying infection or injection, but who are connected with treatment. So all in all, 8 of our patients died at home, on the streets, in the car, in the automobile, or on the working place. One in home for the elderly, but no intensive care was done. So the 4 and 4 were treated in the hospital, 4 for a longer period of time, and 4 only for 1 to 2 days, which also probably did not have many changes due to treatment. In 2 cases, we do not know this at this time, but we will find out. Next slide. So this is a result of our very interesting histological observations. We had we found many characteristic organs and tissue changes which are related to the vaccination that was done. And these were of different, various significance. Now, we found that in 5 cases, the coincidence or the correlation to the vaccination was very probable. In 7 cases, it was probable. In 2 cases, it was not clear but possible. And in 1 case, we did not find any of these changes in any significance. Next case. Now, what were our findings? The most important findings were in the small and larger vessels. Now you can see here a small vessel in the myocardium, and you can see that the endothelial cells are desquamated from the vessel wall, and the nuclei are swollen, and these desquamated cells are intermixed with erythrocytes. Now, of course, this phenomenon can be observed now and then as an autolytic artifact in persons that where postmortem was done. But as the next slide shows, please, these vessels are really inflamed. You can see here that there is a vital reaction. You can see the desquamated endothelial cells with the elongated and swollen nuclei and the small dot-like nuclei of the lymphocytes that are intermixed with them and some erythrocytes. So this is a vital phenomenon, not a post-mortem autolytic phenomenon in these cases. Next slide. So also in immunohistochemistry, you can find that there is a lymphocytic infiltration in the wall and around the small vessel, and all these small blue dot-like nuclei are lymphocytes, but they are not B lymphocytes, as this immunohistochemistry shows. Next slide. So I will show you more phenomena of vessels that are inflamed. Here you can see the dense infiltration of lymphocytes. These are the small dot-like cells around a vessel in the lung. Next slide. You can see lymphocytic infiltration around in the periphery and adjacent to an extended vessel. Next. And also in the brain, you can see that these endothelial cells are swollen and are desquamated from their underlying tissue. Next. And this is another small vessel in the brain. This patient died of a hemorrhage of the subarachnoidal tissue. And you can see that this vessel is full with blood, and the wall is aufgelockert,
destroyed.
Destroyed by lymphocytes that are found in this in here. Next slide. Now, these were the small vessels, and we call this an endovasculitis, or some people call it endothelitis. But we also found changes in the large vessels. This is an aorta, and you can see that there's a area of fresh necrosis in the wall of the aorta, and this is the light area. And you can see that there's some lymphocytic infiltration also in this case. Next slide shows this at a larger magnification. Definitely lymphocytes, these small dot-like nuclei without cytoplasm, which can be seen in the light microscope.
So,
next slide.
Arne, these are T lymphocytes, among which many are killer lymphocytes, right?
Yes, yes. I will show this later in the myocardium.
Mm-hmm.
So just to show you how often we found these phenomena, this endovasculitis or endothelitis, we found in 11 cases, and the main localization was the heart muscle, the myocardium, and the lung. And the vasculitis and perivasculitis of larger vessels we found in 10 cases. And this media necrosis of larger vessels we found in 2 cases. Next slide. And now we come to a phenomenon which I called lymphocyte amok. It's lymphocyte predominant tissue destruction, which you may call inflammation, with imminent prolonged autoimmune disease development. Next slide. Now I will show you that we found these lymphocytic infiltrations in many organs that are not lymphoid organs, not lymph nodes, not the spleen, but like here you see the lung, and you see that there are multiple lymphocytic accumulations in the interstitium and mainly perivascular. So, of course, some lymph follicles are found in the lung, but this is definitely very unusual that you see them in the periphery of the lung in this magnitude. Next slide. And this is a larger magnification. You can see that this accumulation of lymphocytes is not only follicular, but has a germ center formation. So it's definitely activated, and it is in the wrong place. Next slide. And you find these lymphocytes not only in the interstitium, but also in the pleura, visceralis, and you can see some enterocortic pigment, but definitely in this place, not related lymphocytic accumulation. Next slide. And in the liver, we also find these nodular infiltrates, which cannot be interpreted as a hepatitis. It's definitely nodular, and this seems to be an infiltration of lymphocytes also here. Next slide. And we find it in the kidney. This is not glomerulonephritis. It is not a pyelonephritis. It is just an infiltration of lymphocytes in the interstitium of the kidney. Next slide. And some very odd observations. We found lymphocytic infiltrations in a myoma of the uterus. This slide. And next. In the pararenal fatty tissue. Next slide. In the renal pelvis. And this is not a usual pyelonephritis because there are hardly no granulocytes. We found these infiltrations in the skin. Next slide. Another case also in the skin, you see purely lymphocytic infiltrations. There also was some iron deposits in this case. You see these brown spots. So this is typical of leucoclasic vasculitis of the skin. Next. And most alarming in this case, an infiltration in the dura, in the brain covering tissue. And you can see also lymphocytes here infiltrating this fibrous tissue. Next. So these massive or nodular lymphocytic infiltrates outside of the heart and the lung, where we found them mostly, we found in these organs, the kidney, the you can see how many cases where we found it, the thyroid glandula, the aorta, the kidney, and lymphocytic nephritis, and in the dura, one case. Now we come to another phenomenon, autoimmune phenomena that we encountered in these patients that where we examined the organs. We found a pseudo-lymphoma in one case, and we found changes that usually are associated with our autoimmune disease like Sjögren's syndrome, Hashimoto, and vasculitis of the skin, nephritis, and non-alcoholic hepatopathy. So this is a pseudolymphoma. You can see it's several centimeters in diameter and definitely not normal. Next slide. The Sjögren's syndrome, this is the salivary gland, and you can see this nodular lymphocytic infiltration which destroyed the acidic tissue, but it spared the ductal elements. Next slide. The thyroiditis Hashimoto, you can see in this overview that there are definitely nodular accumulations of lymphocytes, sometimes with follicle formation and germ centers, and destruction of the thyroid tissue. Next slide shows you a larger magnification of these lymphocytic infiltration and destruction of the tissue of the thyroid gland. Next slide. This is a change in the liver of two, which we found in two patients. You can see this infiltrations of the periportal fields, and also purely lymphocytic infiltrations. And so we think this might be a non-alcoholic steatohepatopathy. Next slide. Now, coming to the well-known pathology, we come to the conclusion, or I will cite these well-known authors, that hypersensitivity or immunologic reactions may cause myocarditis, and we will look for this. And this is one of the factors in this process is the disturbance of the T cell functions. So in the next slide, I will show you next. I will show you the changes of the myocardium, which we interpreted, which we are sure are inflammatory reactions. And you can see here that there are sparse lymphocytic infiltration, but a marked edema, and the vessels are distended. So next slide will show you, this is a mild myocarditis, but here you can see that there are also areas where definitely the myocardial muscle tissue is destroyed. And again, in contraposition to an infarction, there are almost no granulocytes, but definitely mostly lymphocytes. Next slide. And you can see these lymphocytes marching up in the small vessels, and this is definitely not normal because the lymphocytes only make up a few percentage of the blood cells, and there are almost no erythrocytes in the vessels in this area. Now, we did some immunohistochemistry. Next slide. And you can find that these are CD3 T lymphocytes that are marching into the cardiac muscles. Next slide shows you that these CD3 cells are distributed in the tissue. The cells are marked by this brown coloring, by the way, that for those who do not know this reaction. Next slide. And lymphocytes are not only found in the myocardium, but also on the epicardium, as you can see here. Next slide shows you how often we found this phenomenon, lymphocytic myocarditis, lymphocytic predominance, myocarditis, epicarditis, and pericarditis. It was in a maximum with necrosis of muscular cells. In 2 cases, we found it marked in 3 cases and minimal in 9 cases. As I said before, 1 case was practically none such reaction. But we concluded that a minimal myocarditis occurs in most of these cases that are vaccinated. Next slide. Now, what is important? These lesions were macroscopically hardly discernible, and they are often not interpreted right, but the pathologist thinks this is infarction. And they are typically small, focal, and multifocal. And often they are overlooked in the histological slide. But definitely these have a devastating effect on the action of the heart, and especially if you have a heart which is over the critical heart weight of 500 grams, the destruction of just a few muscle cells may have a devastating effect. And if these inflammatory infiltration is found in the where the Reizleiter, where the impulse for the contraction of the heart is given, this may lead to heart failure,
Standstill.
Yes. Okay, next slide. So myocarditis was the most frequent finding that we had, and the second finding that we had in almost all cases was a lymphocytic pneumonitis or alveolitis, as you may call it. And you can see here that the lung tissue has collapsed. There are definitely dense lymphocytic infiltrates and some beginning fibrotic formation. Next slide shows you another area, and here you can see the lung tissue is definitely has very changes that and also lymphocytic infiltration and nodular formations. Next slide. So these lymphocytic alveolitis or diffuse alveolar damage, or as you may call it, lymphocyte predominance alveolitis, is often not diagnosed. Macroscopically, it has the appearance of a lung fibrosis or COPD. And we found it in 3 cases in a maximum with formation of lymph follicles. We found it in 4 cases in a very pronounced degree, and we found it in 1 case deutlich and minimal in 5 cases. Next slide. So coming to the pathogenetic interpretation of this finding, lymphocytic interstitial pneumonia or alveolitis is frequently associated with autoimmune system disease, and as we have shown, we've also found Sjögren's syndrome, nodular lymphoid hyperplasia or pseudolymphoma, Hashimoto thyroiditis, chronic active hepatitis, and myasthenia gravis, and it might be a precursor of malignant lymphoma here. So next slide. Okay, so these are our findings and our interpretations, and I think this lymphocytic AMOC is a very alarming finding that we had in most of these cases. Thank you.
Thank you very much, Arne. This is mind-boggling and shattering because I'm a microbiologist. So when I said children stand against the wall, we're going to shoot the water pistol at you. If that pistol were really loaded and we were shooting real bullets at our children, and of course at anyone who's taking these jabs, what I would say is that you have shown us the bullets. The bullets are the lymphocytes, the T lymphocytes, the killer lymphocytes that are pervading so many organs that you just got to be horrified. The heart, the lung, but the same people who have lung problems and heart problems also have liver problems and brain problems. This never occurs in biology and medicine. I don't think you've seen anyone with a combination of such lymphocytic killer cells, or have you, in your 40 years of practice?
No, definitely not.
That's a good, don't have to say anymore, of course, because they are not described in the textbooks. I looked it up.
Yeah.
There is no description. And because this is typical after vaccination, it proves that the vaccination is the cause. Our time is up, Arne. Our time is up. And I just want to say that I think that we have all just experienced probably the most moving half hour of our lives, because we now know that these vaccines are putting bullets, and the bullets are from our own immune system. How mad and bad can anyone get? And I am calling to all our colleagues around the world, the doctors, to stop firing these pistols, especially at our children. Don't you dare to do this, because if you do, you will be brought to justice, as will all the authorities, the politicians, the people who have been driving this agenda over the past 2 years in the most criminal manner. I think we will say goodbye to you now and let the next take the stage. Thank you very much, Arne.
Thank you.
Okay, thank you very much, Sucharit and Arne. These were very striking observations that we were just acquainted with. Anybody with a medical training will see just how devastating the effect of these vaccines can be, at least in those who die after the vaccinations. It is pretty clear after reviewing this impressive evidence that a very great share of all fatalities that occur within a short time frame after vaccination will probably be due to these vaccinations. And I guess we now also know why the authorities were so very hesitant to have autopsies performed on such victims. Now, not everybody dies after vaccination. There are people with transient effects or even with no effects at all. So we may wonder what is occurring in their bodies. Are there any findings at all? And our next guest, Dr. Carsten Stümke, is going to shed some light on this. Carsten, please.
My name is Dr. Carsten Stümke. I'm an ophthalmologist in Germany, and I want to present you 4 clinical cases of small vessel disease of the retina and the optic nerve. So my patients, the age was from 65 to 75. All patients received 2 or 3 injections of a COVID vaccine. There was no clinical emergencies. All patients came to me to a regular control visit. I think it's important, none of them told me about vision problems. The patient's medical history, arterial hypertension, diabetes, or high blood cholesterol, common diagnosis for elderly people. So what's the eye doctor doing? First, we do an ophthalmoscopy. We can see a healthy view into the eye. It's the eye of my wife. We can see the center of the retina, the macula, with a high resolution of color vision. We can see the optic nerve head, and we can see the big vessels here. This is a vein, and this is an arteria, and you can see the small vessels. We are also doing a field of vision. The field of vision is the area which we can see without moving the eye. Here you can see a field of vision from the center up to 30 degrees. This is the upper field of the vision. And we have optical coherence tomography. It's a laser examination to measure the retina, its thickness. You can see a normal retina here with a green circle and a blue spot in the middle. So my first case had an arterial disturbance of the optic nerve. On the left you can see the vaccination record, and on the right you can see the visual field with a small defect in the upper field. The laser scanning tomography, you can see here there is more blue, and here you can see a green area. This is a pathological thinning of the retina in the lower field. 1 year before, it was clearly normal. Case 2, the vaccination record, had a microthrombosis near the fovea. It was important that this patient got general symptoms 1 day after 3rd vaccination, with generalized swelling of all lymph nodes and fungal infection of mouth and esophagus. Here in the photo, you can see the little bleeding near the center of the retina. Case 3 had small vein occlusion and progression into the center of vision. There was 2 injections, and after the 2nd injection, this patient got a stroke and a cardiac arrhythmia. This patient came to normally eye examination with normal vision, but there was subsequently deteriorating eyesight from 25/20 to 14/20. this patient got an improvement after therapeutic intraocular injection. On the photos, you can see the first visitation, bleedings here, there's the center, and in the second visitation, more bleedings here and a swelling near the center. In the laser examination, you can see here a typical swelling of the retina and an increasing thickness of the retina at the second visitation. Case 4 had an occluded vein near macula. In the laboratory, we are seeing a slightly elevated D-dimer test indicating activation of blood clotting. You can see here bleedings near the center, and in the laser scanning, you can see here a typical swelling of the retina. So what is the conclusion? All patients presented here have a high blood pressure, diabetes, or high cholesterol. Patients with these diagnoses have a higher risk for vascular disease in the eye, like arterial embolism in the retina or the optic nerve, and also a higher risk for venous thrombosis in the big or small vessels. So this finding could be accidental, especially in these elder persons. On the other hand, we know that COVID vaccination also can cause vascular disease, like venous thrombosis in the vessels in the brain or in the gastrointestinal tract, and also stroke and heart attack. So are my findings secondary effects of a COVID vaccination or not? People with vascular problems of the eye typically visit the eye doctor because of major symptoms, such as loss or deterioration of vision overnight or over a few short days. Such cases typically are diagnosed with a bigger infarction or thrombosis in the eye. In contrast, none of these patients presented here complained of any symptoms, neither blurred or reduced eyesight, nor defects in the visual field at the time of examination. But the abnormal findings in the eye are clearly visible for the doctor. This is remarkable. But among all of our patients, we see these diagnoses at most once a year. It's my own statistic of the last years. These 4 clinical cases presented here all appeared within a time period of only 5 weeks. All patients have the same pattern of disease, small vessel disease, initially without symptoms. All patients got their second or third vaccination days or months before diagnosis. So further studies is necessary to investigate if these findings may be a side effect of the COVID vaccination. I appeal to all ophthalmologists to watch out for these cases with vascular disturbances after COVID vaccination, especially among patients calling for routine control visit. Otherwise, we will fail to notice them. And finally, all vascular disturbances that subsequent to COVID vaccination should be reported to the government public health agencies. Thank you.
Thank you very much, Carsten. This was another very instructive and impressive presentation. So we see from your findings that most likely also in patients who themselves may not even be aware that something went wrong with their eyes after vaccination, that small but discrete signs may very well show up. Now, we must expect that in those patients that experience stronger effects, that actually visit the doctor because of any symptoms they experience, the damage may be proportionally larger. Now, even so, these 2 presentations, right, acquainted us with cases that come from the opposite sides of the spectrum, right? On one hand, we have those who succumb to the after vaccination. We have, on the other hand, those who didn't even notice anything amiss, in both cases, there is at least one common theme, and that is that the disease focuses on the blood vessels. And that is indeed in keeping with what we understand about the distribution of the vaccine in the body, right? We know that briefly after vaccination, the vaccine appears in the bloodstream, okay? And then things will start there. The vaccine will affect the endothelial cells of the blood vessels, and then things will simply go downhill from there. And the vaccine expressing cells, right, the spike protein expressing cells will become under attack by the immune system. So this is exactly as one had to expect based on fundamental immunology. Okay, another question we might ask, right? Arne Burkhardt told us that the patients that he examined, the autopsies, were from patients who died up to 6 months after vaccination. Is it plausible that these findings might still be related to expression of spike protein? In this context, I will just mention one recent study that showed the spike protein. It could still be detected after at least 4 months after the second vaccination, right? So that actually really makes it plausible that inflammatory autoimmune-like disease will still occur at this prolonged time after vaccination. Okay, so it is important to find these cases. How do we do so? Obviously, we need more autopsies, right? Family, doctors, whoever is in a position to demand an autopsy must do so, and they must also insist that this autopsy be done right? You saw the findings that Arnold showed us. These were all histology preparations, right? One has to be careful. One has to perform fine tissue examinations top to bottom in order to observe all this inflammation all over the body, which is, as Sucharit pointed out, really unique and characteristic for this particular situation. Also, the ophthalmologists, right, they are in the privileged position to get a direct view of the condition of the blood vessels, right? The retina is a perfect spot for observing the health or disease of the microvasculature, and it would be very important for the ophthalmologists and the optometrists of the world to take the time to make these observations, record them, and share them, so that the world can actually be objectively and scientifically informed about what these vaccines are really doing. So I would think I will leave it at that. And I want to briefly mention, right, in the upcoming break, we will actually play a teaser for the Planet Lockdown movie on vaccine passports. Thank you very much.
Vaccine passports are coming. Someday soon, you may need to prove your COVID status to go to the pub, travel abroad, or even go to work. Governments hope these passes could be key to kickstarting the economy and restoring basic freedoms.
Now they want vaccine passports to control who can go where, when. A nightmare, Orwellian infrastructure of control, an unprecedented, undemocratic power grab.
This is literally the end of human liberty in the West if this plan unfolds. It's not about the vaccine, it's not about the virus, it's about your data. And once this rolls out, you don't have a choice.
You don't need vaccine passports. They provide nothing whatsoever to you or anybody else in relation to safety, but it will give away to whoever controls that database and the rules complete control over everything you do.
Ultimately, what it's going to evolve into is a financial transaction system where not only can I watch you 24/7 and collect data from your body, data from your mind, data from your activities, but then I can stop you from moving around spatially, or I can turn off your ability to transact.
Hello everyone, meet Lucy, student in psychology, and me, her digital ID wallet issued by the government to offer a wide range of identity services. Right now, I'm reminding Lucy of the appointment she needs to schedule for her mandatory vaccination.
What the immunity passports really do in the end, this is what we're hearing from Israel, which is probably at the forefront of this, is it's creating vaccine apartheid.
You're owning this vaccine passport and it pings, and in addition to advising you need to come to the health centre for your top-up vaccine, perhaps your second one in a year, it also advises you that you need to bring your small grandchild down because your daughter hasn't brought the little lad in yet, and they say if you don't bring that grandchild down, your vaccine passport will expire and that of your daughter as well. Now try resisting that.
Make no mistake about it, those individuals who have gone through a normal vaccination series for COVID, you will be determined to be unvaccinated very soon. They will do that. They are going to tell you you're unvaccinated and you have to get a booster, otherwise you could potentially face loss of employment or other types of penalty.
Boosters, it's very clear that getting 3 jabs, getting your booster, will become an important fact, and it will make life easier for you in all sorts of ways.
As it emerged that a booster jab may be needed every year.
It's going to be a vaccinated economy, and you get to participate in that if you are vaccinated.
There will be no return to the old normal for the foreseeable future.
Germany, along with other European countries, imposed new partial lockdown measures earlier.
Just after 11 days of the second lockdown, a third one.
But at midnight tonight, Victoria's plunged into lockdown number 5.
Can you please explain how keeping people at home from 9 p.m. to 6 a.m. is going to help the situation?
And that's just the way it is. We've got to accept that this is the new world order.
Today is the first full day of the new world order.
So people assume we are just going back to the good old world which we had. This is, let's say, fiction. It will not happen.
In the entire history of mankind, there has never been a political elite sincerely concerned about the well-being of regular people.
This is very close to a society of slaves. There is a small elite group who controls the rest. This impression is left now after this year of experiences of lockdowns and other measures, now with the ever more necessity to be vaccinated. Therefore, one can believe that there is the aim of create a new social system, an order.
It's almost like a civil war-like scenario which we're ending up with. People who got vaccinated and people who didn't get vaccinated. People who got vaccinated supposedly will get their rights back, as though we need someone to tell us that we have our rights. No, these rights have always been there.
If a few people want to control the many, the question is how can you herd all the sheep into the slaughterhouse without them realizing and resisting? So the perfect thing is invisible enemies. A virus is perfect because it's invisible. You can't prove that it doesn't exist because it's invisible. So invisible enemies are always the preferred one, particularly if they scare people. If you can use fear and introduce significant fear, then people will need government to protect them from the invisible enemy. Then the second tactic, which is very effective, is divide and conquer. The media plays a very important role. If you can turn men and women against each other and black and white against each other, these are all ways to institute fear and get people to go along with things. What COVID-19 is the institution of controls necessary to convert the planet from democratic process to technocracy. So what we're watching is a change in control and an engineering of new control systems. So think of this as a coup d'etat. It's much more like a coup d'etat than a virus.
And this is always the trick. Once you have the people scared, they will accept everything. The plan is very clear. The health crisis has been used to achieve a total control on the economy, on the lives of the people. They want to transform the world into a system which is probably close to the Chinese system. You know, in China they have this social point system. They have no freedom whatsoever. They are just in a big cage, in a big prison, an open air prison where you have to do whatever you're supposed to do.
Ladies and gentlemen, welcome to our second session. Our topic is global coup d'etat. A year ago, when I first attended my first meeting of the Doctors of COVID Ethics, there was a heated debate on a scientific topic. And in the middle, Dr. Michael Palmer said, "We don't fear this. We have nothing to fear except tyranny." And I thought, okay, I'm with my people. So what happens when science and medicine is used to engineer a global coup d'etat? Well, then you have to integrate what's happening in science and medicine with what's happening politically around the world. And so we have three great presentations tonight. The first is from Dr. Michael Yaden, who is a chief scientist and vice president, was a chief scientist and vice president of Pfizer's Allergy and Respiratory Research Unit in the UK. Then we have a discussion with Brian Garish, the publisher and founder, one of the founders of UK Column, who is our sponsor this evening, and Dr. Pierce Robinson, who is the co-director of the Organization for Propaganda Studies. We're going to talk about how we push through the propaganda, and then finally, a wonderful discussion with author and attorney and chair of Children's Health Defense, Robert F. Kennedy, on the real Anthony Fauci, his blockbuster global bestseller, which is Pushing Through the Propaganda. So let's dive in with our first presentation. The title of Mike's presentation is 2 Minutes to Midnight, Where Are We Now? I asked Dr. Yaden to give a presentation on his assessment of our current situation. I'd like to point out that in addition to a very successful career in the pharmaceutical industry, then founding and selling his own biotech company, Dr. Yaden was enjoying the rewards of a beautiful family and a highly successful career, and yet took the time and took the risk to become literally one of the most courageous and powerful voices, warning us of the dangers of the COVID-19 injections and the use of the vaccine passports to engineer a global coup d'etat. It's always inspiring for me to listen to him, and so I thank him again for taking time out of his schedule to do this. Ladies and gentlemen, Dr. Michael Yaden.
Hello, everybody. Good evening, and Catherine, thank you for that over-generous introduction. It must be Mutual Admiration Society, because I love listening to you, and I've learned so much about the missing parts, shall we say, of the coup d'etat. Because I can describe what's happening scientifically, but I guess I don't really know why, and you've filled in some of those blanks. As for the courage bit, I don't know. Once I spotted something awful was happening, I've often said to people, there's no peace in denial. So once you realize something's really off the rails, you can either kind of cower somewhere until it hits you, or you can stand up and try and do something. And I did the former. So, okay, so yes, it's difficult. Those of you who've seen me before, you know, you can see me sometimes going painfully through every single little detail of the lies and the non-pharmaceutical interventions and so on. And then it's the toxicology of the vaccines. And you've probably heard that too many times. If there are any new people, welcome. Where have you been? Seriously, we've got to spread the word that there are problems and that you can fix it, and you mustn't wait for anyone else to, as quickly as we can. So anyone who's not seen me present before, you should be able to find, don't use Google, but other search engines are available. So yes, 2 minutes to midnight, Catherine invited me to speak, and I wasn't sure if I had anything new to say, and she said, well, what's on your mind? And that was pretty much it. Not necessarily everywhere in the world, but I'm in the UK, I'm in England, and I've noticed we've been surrounded over the last few months with coerced practices for vaccines, introduction of vaccine passports, they're spreading, discussions of mandates, and here we were sitting in like an oasis. We hadn't even got to wear masks, but I said it's coming, I'm afraid. And 2 days ago, the Fat Controller, Boris Johnson, Prime Minister, told us, alas, we have to have vaccine passports. Now, I mean, he's a liar, along with all the scientists and medics advising the government. You don't need any such thing. They're an absolute control mechanism that don't make anyone safer. So the reason I'm saying 2 minutes to midnight hit home hard 2 days ago. I've often said to people that I can't see an easy way of extracting a well-established and unfortunately accepted and used vaccine passport scheme. And I'll say why. I don't want to be negative, but I want to, the message I've got for you today is if you're in a place where vaccine passports haven't yet landed, stand ready to repel all borders. The first time you hear them, see them, whatever, obviously not violently, but everything but, you must do everything but. Don't think, well, they're only in a foreign corner of the country and they're only needed for visiting nightclubs. They metastasize until they're right at your door. That's what will happen. That's how they do it. So yeah, I've been introduced as a scientist. Thank you, Catherine. Just very quickly, double first in biochemistry and toxicology. I have a PhD in respiratory pharmacology, and yes, many decades in biopharma R&D. And then yes, I was very lucky to have a chance to run my own biotech company with former Pfizer colleagues. And after 6 years, we got acquired by Novartis, and I got a large check. So I was very happy with that. So just very quickly again, I don't really mind what people say about me, but I want people to know this about me, that the motives they ascribe to me or hint at, all of which are not true. So first, Eden's a grifter. I think that means making money. Well, one, I don't need any money. I'd like some time to spend the money I've already got, thanks. So I don't need a penny. And not a single thing, you won't find a single thing I've ever done on the internet that makes me any money. So that's not true. The next thing is, he's going for fame. I am by inclination an introvert. I've done my whole career on what's called an extroverted auxiliary, which means you have to work really hard to pretend that you're an extrovert. So I hate this. I don't like being in the public. And so that's not it either. I don't like being famous. Disgruntled former employee is obviously silly because I had a good time at Pfizer, left on good terms. A year later, I did a business deal with them, and then they were on my board for 6 years until 2017. So we were all very happy. So so there's no motive now. There's no motive for me to be talking to you like this, except that I'm telling you what I think is the truth. So you've got two choices. Either Eden's competent, what he's been telling you is probably accurate as far as he can judge it, or he's literally gone mad. I don't think I've gone mad. So I think I'm telling you the truth. And of course, I'm also operating according to my values. You know, I don't like unfairness, I can't stand the cheating. And you can tell when you're operating by your values because it's costing you. And it's costing me money, it's costing me hits, reputation, friends, smears. None of that matters if this wakes up some people. Right, swiftly on then. So I'm going to talk a bit about vaccine passports. So just touch on the so-called vaccines. I've been in the belly of the beast, you know, helping make new medicines. So of course, I'm a big fan of innovative new medicines, provided they're safe, provided they've been well developed and used appropriately. Now, these novel gene-based creations are the very best you can say is rushed. You know, I don't know, 6 months, something like that. You really should be taking 8 to 10 years. Now, you might say, well, it would take too long in a pandemic. And I would say no one has ever turned off an infectious disease pandemic using a vaccine. You know, not a new one anyway, a new infectious disease. So we didn't need to rush these vaccines. As it's turned out, we've got some really good, well understood old off-patent medicines that are being repurposed for various components of the disease that we call COVID-19, virus replication, inflammation, disturbances to coagulation, and so on. And if you look up many physicians, but Dr. Peter McCulloch in Texas is a good one I always recommend. He teaches so well, and he's passionate, and he's co-authored, as it were, treatment, not quite treatment guidelines, but a review of all the things you can do to treat patients when they're symptomatic out of the hospital, in hospital treatment, and also things like prevention. So we had good treatments. They're really good. And most people, this is the thing, this virus SARS-CoV-2, if you acquire it, most people don't get seriously ill. You'd better not have it. I think the killing power, bluntly, is similar to a bad seasonal influenza. It's not fun. I don't recommend it. But most people don't get seriously ill. So you were lied to and told something like 10 times worse. It's simply not true. And then finally, if you get the disease and you're really quite sick and you benefit from treatments and you'll survive mostly, you will then have what we would call one and done immunity. Once your body has fought off this virus, you've memorized lots of pieces of the virus and formed an extremely good natural immunity, which is powerful and it's complete, it's durable. So we didn't have to have vaccines. At any point, we could stop using these things and go to plan A, which is just treat appropriately, don't worry, and then recognize that once it's been through each person, only the ones you can't catch again, can't get ill again. So that's really the background to it. I could spend more of the time I've got talking about non-pharmaceutical interventions, the lies about masks, lockdowns, PCRs, asymptomatic transmission, and frightening variants. But I won't take any time on those because I've recorded those in the past. So these vaccines, I've had loads of vaccines. So have my children. I think all of us recognize a vaccine as something you go and see a healthcare provider, you turn up and you're perfectly well. You should be anyway. You have the injection, brief soreness in your arm, and you leave perfectly well, and you should stay that way. And what benefit in addition you should get is that it should stop you getting the illness on the box. That's the whole point. They don't stop you getting the illness on the box or getting clinically ill with whatever this infectious agent was. You've really wasted everybody's time. And one of the benefits of stopping you getting the clinical disease is you don't fill up with the virus or the bacterium and shed it all over other people. So what I'm saying is a good vaccine, all other vaccines, reduce or block transmission to other people. So each person acts as like a chain breaker. They get protection and they're a chain breaker. And then finally, of course, they're generally pretty safe. I know there's controversy about vaccine safety, but compared with the COVID-19 vaccines, stuff that's gone before is pretty damn safe. I'm a motorcyclist, by the way, so I might have slightly different gradings of relative risk than you. So yeah, stop you getting ill, stop giving it to other people, and safe given the context that it's being used in. And unfortunately, we've got COVID-19 vaccines, I think 4 of them, 2 mRNA and 2 DNA types, and unfortunately they don't do any of those things. They don't stop you catching it. Once you've got it, it will grow up inside your lungs to the point where vaccinated and unvaccinated people, where positive, have the same viral load. That tells me straight away, actually, they're not working at all, because there's no black magic that can take you from that point to stopping you getting very ill. It can't. If you just sort of join the 2 points of infection and growing a culture, there isn't any magic that will suddenly make it start working at that point in the infection. And they're not safe. If you look at public databases like VAERS in the States, in particular, a former entrepreneur called Steve Kirsch, K-I-R-S-C-H, he's got a website and he's all over this stuff, having been a fan of vaccines and then noticing something was up. So where are we now then? Certainly all around Europe, we are either 1 minute to midnight or 2 minutes to midnight, because they're introducing vaccine passports. Now, the only possible argument, I think, so public health argument for introducing this little bit of card to say you've been vaccinated so you're safer to be around, is if those treatments reduced transmission to others. They do not. It's not in dispute. SAGE doesn't say so. The UK government doesn't say so. So please, you're not safer standing next to someone in a bar that's been vaccinated. Not at all. and the government doesn't say so either. So why are they asking you to carry these things? And I'm afraid the answer is, again, like all the other stuff, it's all lies. It's all about control. They've sneaked it in. We've seen it in European countries. They're doing it now in the UK. So they'll start with places you probably don't go, like if you're my age, probably not going to nightclubs. So I'm not personally affected by the news that you'll need a vax pass. That is to demonstrate that you've been vaccinated before you can get into a nightclub. But that's how they do it. It's like dropping a cancerous cell in your body and you're not noticing because you're immunocompromised, and it grows and metastasizes and then it kills you. And that's what this is going to do. So don't tolerate them anywhere in your country. The system will form itself, and I cannot see a way of removing them. Imagine an old lady going into Sainsbury's and they beat their vaccine passport to get in through the door. And I said, they don't do anything and they're backing away from me. And I'm saying, put your vax passes down, and they will feel at risk. Once these things are in your country and being used to regulate access to essential services like food, money, fuel, trains, and things like that, you'll never get rid of it. Even if you told people what I'm just telling you, never get rid of it. Because a third of them will think you're actually going to make their existence very dangerous. Got to stop it beforehand. Got to stop it. And I've been saying this for, I don't know, a year. And this is the last chance. If we let this go by and they're in the country, I just don't see a way of getting them out. So in terms of what will happen in the end, I probably don't want to go any further because it's not scientific, and a lot of it I've learned from our chair in terms of likely financial reset. Basically, you will lose the ability to decide where to be at any time. The vax pass will be used to regulate entry and exit from almost any controlled space, possibly even including your own home. And then the worst part, or not the worst part, but an additional part, you'll be required to keep your vaccine passport up to date by being fully jabbed. Don't use the expression. It's not fun, and it's not just a needle. So fully vaccinated means 2 injections, but it'll soon mean 3, then 4, then 5. Australia has just made a bulk order of COVID-19 vaccines sufficient to administer another 10 injections of the stuff to each citizen of America. So I wouldn't say that's the end of them, but you should assume if you go along with this, if you think, well, it's all right, it's a virus, it's not, is it? I mean, it's completely barking what they're doing, but that's what will happen everywhere. And I think gradually it will kill a lot of people. I don't know if it's really depopulation, but it's going to cause huge amounts of deaths. So yeah, 2 minutes to midnight. I don't really know how to stop it, except that I know that the more people who know that this is a con and are willing to say to other people, government's conning us, they're lying, they're not being straight. That's, in the end, that's about the only thing that'll work. I'm not seeing any signs of politicians in the UK. I don't know whether any of them have really sussed it. If they have, they're being cowardly. And if not, they're quite stupid. We did try very hard last year and got nowhere. So it's not going to be political leadership that will save us. I see no evidence from any religious community, with the possible exception of Judaism. I've spoken to 4 different groups of rabbis, and they've at least issued some statements that are extremely supportive of what we've been saying. So if it's not politicians and it's not the religious groups, it's us folks. And not even me. I can't save myself. So it's people who are listening. So whilst it's useful to have a reasonably good idea, sort of the big picture level, enough to know you're being conned and feel really angry about it, maybe to be able to convince other people that this isn't right. But then you need to go to act local, really. I mean, honestly, persuading people in the street, things like that, going to the pub and talking to people, it's the only way. So, one last thing I wanted to say. If the vaccines were about public health, which I've told you they're not because they don't stop you catching or transmitting it, and they injure you, some people anyway. If it was about public health, here's a few tests. People who've already been infected with the virus, whether or not they got ill and have now recovered, we know there's over 100 papers confirming really solid natural immunity. These people would be excused. Why would you waste money giving them to someone who's already has superior immunity to anything you can get from the vaccine. Also, it's dangerous to vaccinate people who've already recovered from the disease in question. So that's not right, is it? They are injecting you even if you've had it. They wouldn't give it to children either, because in the main, healthy children don't get ill with this virus. They don't die. And because they don't get ill, they don't transmit it either. But we're injecting children. It's awful. I just feel terrible. And then finally, if it was about public health, we wouldn't be injecting pregnant women. They have not completed what I call reproductive toxicology. We've no idea if this is harming babies in the womb or preventing eggs being fertilized, because the studies have not been done, and they've just lied to women and told them, oh, it's quite safe. So those are three good tests for you. So it's not about public health. What is it about? Totalitarian control. It's a control system. Here's the two last things I would say. It's totalitarian. So it covers absolutely every aspect of your life. There's no hiding place. It's permanent. Aldous Huxley said, scientific and technical tyrannies never go away. It's not like religious or political ones where you can get tired and kill them. Scientific tyranny is in place until it deepens. So it's permanent, totalitarian, and it's nearly here. I'll stop there.
Mike Yaden, I don't know why, whenever I hear you talk, my batteries are recharged. I'm ready to go back out there and fight.
Well, absolutely. I'm pretty punchy, as you can tell. We don't have long. We don't have long.
I know. I totally agree, and I couldn't thank you more for making it so clear.
Okay.
So with that, let's turn to our our new discussion with Dr. Pierce Robinson. Let me introduce him. He is the co-director of the Organization for Propaganda Studies, and he researches and writes on propaganda, media, and international politics and conflict. He is the co-editor of the Routledge Handbook of Media, Conflict, and Securities, and he has published in a list of articles that is too long for me to describe today. We're also joined by Brian Garish, who had a very successful career as a Royal Navy officer, went into the private sector, and then got irritated by the corruption and co-founded the UK column newspaper. Lead off, Brian, by welcoming you and Pierce and thanking you for your support of the Doctors for COVID Ethics. This is the second symposium we've done with you and your team. Marvelous job on, and you're somebody who's cutting through the propaganda every day, and I just want to thank you. Is Brian with us? Can you hear me?
Unmuted. You should be able to hear me now, I think.
Now I can hear you. Okay. And then Pierce Robinson. So let me just kick off this discussion and say, what can we do to cut through the propaganda? So this symposium offers marvelous content, but as Dr. Yaden said, we have a very short time. Pierce, maybe you could tell us a little bit about, in your study of propaganda, how do we cut through the propaganda and what has worked, whether on COVID-19 or other moves to centralize political and economic control?
Well, I think the first most important thing in terms of getting people to realize and to understand and to then sort of contribute ultimately to resisting this is really to get people to understand, and this is point has come across in the presentations tonight, that this is not about a virus. Getting people to understand that there is a political and economic process, a restructuring agenda which is going on, which essentially is exploiting COVID-19 as an opportunity to usher that through. And in some ways, quite a lot of progress has been made in the last year. I think a lot of scientific organizations who've been pushing back against the COVID policies have started to understand that better and are now starting to sort of engage that. But it's critical that we get the debate properly onto what is actually underlying COVID-19 and helping people to understand that and that to become clearer in people's minds. Because you can't fight the enemy unless you know where the enemy is and who it is and so on, and you can picture it. So that's a very important thing. I think in conversations I have with various people who are involved with trying to push back against COVID-19, it's clear that there are a lot of organizations globally who are quite well organized and who are pushing back. So there is already a considerable resistance. There's also considerable resistance across the population, maybe up to 20% of populations opposing what's going on, willing to go out on the streets. And that gives you, I think, sort of the baseline for developing a much more stronger and cohesive global pushback against this. But that requires organizations putting back to, I think, start talking with each other more, coordinating, linking up, and so on. But that can be done. And in sort of tactically, it's, again, some people get very pessimistic about what's going on, but I'd guess that maybe 20% of populations across the democracies have bought into all the propaganda. 20% don't buy it and are resisting in some way. And then there's a big sway, 60%, who sense something is wrong, but don't fully understand what's going on. And I think targeting that section of the population, that middle ground, who don't buy all the propaganda, sense something is wrong, but don't fully understand that this isn't going to come to an end with government saying, oops, we made a mistake, the scientists got it wrong, that there's a political and economic agenda underlying this. So it's getting that understanding out there is critical. And I think that will do more than anything else in terms of waking up more people and bringing them over. Because I think, as Mike even said, we're not going to be saved here by institutions, by mainstream media, or by governments. They're all caught up in a deeply corrupt system, and they're engaged. They're the ones who are doing this restructuring. So they're not going to save the day. Mass mobilization is going to save the day with this. But as I say, that requires organizations pushing back. And there's a lot of great organizations, Doctors for COVID Ethics, PANDA, Kennedy's Children's Health Defense. These are all well organized, and they're learning, and they're developing their understanding, their deep level understanding of what's going on. But these organizations linking up, engaging with the public, are all ways that we can start to win this fight. But recognizing those things, that the bigger picture there, and recognizing that our institutions are corrupt and will not save us. The final thing, I'd say about, it's important that people are pushing back, engage through social media and the internet. Yeah, that's an important part of pushing back. But getting out on the streets, getting leaflets, informing the wider public, because we're all not in quite an echo chamber, we're in bubbles on the internet. And there's a big audience out there who simply don't engage, and they're confused, and they need leadership and they need direction. And if we can get thousands of people out on the streets and demonstrations, those people can also get out on the streets, deliver leaflets, and so on. And that can spread the word much more rapidly that what we have been told about COVID-19, as is clear from the presentations today, is not true, is not accurate, and that there are other things going on. And that way, I think we have a chance of winning this epic struggle that's going on at the moment.
So I couldn't agree more. Brian, I see you and your team at UK Column is doing a very effective job at reaching out to the 20% Pierce described, but also that 60%. What have you found that works? What do you think we can do in our next 2 minutes to midnight to reach that 60%?
Speak to people in a very targeted way. We've got to know exactly what we're fighting, and then we've got to explain to them what we're fighting in simple terms. So Piers mentioned just then, I think that we can't fight what we can't see. So what is it that we can't see at the moment? And I think the key thing is, if we take your statement, Catherine, which you introduced us with, which is people being led to the slaughterhouse. How is that happening? Well, it's through fear, but of course we're seeing the state use massive propaganda and millions of pounds, millions of dollars put into the propaganda to help force through this lie about COVID and the pandemic. But if we go to the propaganda, there's two types in my view, and that is we've got overt propaganda. We can recognize it as propaganda. We can see it as being propaganda-like rhetoric. And then we have covert propaganda, and it's the covert propaganda that we've got to bring to the surface. We've got to explain to people what it is and how it works. And what am I talking about? I'm talking about deep applied psychology. I'm talking about behavioral change. This is what the British government's Behavioral Insights team is all about, using applied psychology to change, quote, the way people think and behave without them realizing that their behavior has changed. And this is the really insidious thing. If you can use applied psychology to do this, and I'm going to assure the audience tonight that the UK government can do this because it boasted about it in a Cabinet Office document in 2010 called Mindspace. It said we can change the way people think and behave, and they will not realize this has happened. So if you follow that through, we've got propaganda operating on the public, and this is in UK, it's in the US, it's worldwide now, where people don't understand that they're getting a message which is drilled right into their subconscious mind. This is not fantasy, what I'm talking about. If you read that Mindspace document, you can read the British government boasting it's got this technology, and that technology initially was sold through to America and Australia in the first instance, but there's no question that it's now moved through into the European countries and on to New Zealand and worldwide. So the first thing I think we need to do is we need to home in on the use of applied behavioral psychology. That's the malicious
Sorry, Brian, I couldn't hear your last sentence. Could you just repeat it? Did I lose Brian? So Pierce, let me ask you
you've just come back.
Yeah, you've just come back. I lost your last two sentences. Can you repeat them?
We need to explain this covert propaganda, this applied, malicious political applied psychology. We've got to explain this to people. We've got to tell them how it works, and we've got to identify the key people that are using the psychology. It's no good saying that the British government is using it. We know that people like Boris Johnson are within government's COVID SAGE unit.
Okay. So Pierce, let me ask you, one of the things that I had a conversation with Robert Kennedy, which we're about to play, and one of the things you see in his book is we're starting to watch networks of people come together from many different walks of life and integrate their knowledge in a way that is busting through the propaganda. And I'd like you, just in your experience in dealing with this for the last year and a half, are you seeing that integration of people in different industries and specialties coming together to collaborate to make a change here?
Yeah, this in my experience, this is definitely happening. I mean, at a very general level, over the last 2 years, I've seen more people talking about propaganda and deception and so on than I've ever seen in my life as someone who studies that area. But specifically, yes, as I said before, that there are many organizations. There's been organizations set up from fairly early on, especially occupied by scientists pushing back against this. Those organizations are much more extensive now. There are many around the world. And there's also, as the authorities become more extreme, which they are, they're becoming with mandates and so on, you're seeing in my immediate sphere of influence, you're seeing more and more professionals, for example, who are starting to question what's going on. I've noticed on LinkedIn, which of course is the social network for professionals, a big increase in the traffic and the number of people, and also connecting with people like me, for example, and starting to raise questions. So I think awareness is beginning. There is clearly more communication and linking going on between organizations around the world. And there's also a population which is increasingly, and as the authorities get tougher, will be increasingly driven to engaging in resistance, pushing back protests. And so I think we're on that path. I don't want to be too optimistic because I think we're in the middle of a fight and it's not clear what the outcome will be. But I think that with the kind of scale of resistance we see and the numbers of organizations and just the sheer number of, for example, scientists and eminently credible scientists who are simply speaking out on the COVID-19 issue, let alone sort of scholars and researchers who are starting to say, hey, wait a minute, there's something else going on here. I think with that weight, I'm hopeful that the people pushing this agenda, this coalition of interests, big tech, big pharma, etc., Western liberal state, deep states, and so on, that they're going to find it very, very difficult to push through their agenda. And this is one of the reasons why they're getting particularly nasty at this point in time with mandates, threats, what's happening in Austria and Germany, and so on. So I think it's coming together, but the time is to organize. And there's also time for people who do have doubts, and I'm sort of speaking to the wider public, to get informed and to speak out. This is a point that's been made by other scholars, that in this situation where there's this scale of propaganda and almost this kind of mass sort of indoctrination of a section of the population, that just acts of speaking out, of doctors speaking out, nurses speaking out, makes their life much, much harder. So now's the time for people to stand up and be counted. And for those of us who have been pushing back, to get more organized than we have been.
Yeah, I definitely want to be on your side and Brian's side when in this battle. So Brian, we have one more minute. Just quickly tell us, the audience is listening, give us some tips on what we can do this month, this week, now to really push forward. Any thoughts?
Yeah, the immediate answer to that is the very simple thing, which is speak to other people, but in a very quiet, measured way. Don't push too hard. You just sow seeds. You talk about it. If there's any signs of resistance, then you just back off. And next day, you're going to be trying again. Keep talking to people. But I'll add, the people we need, we can now see doctors speaking out. The people we need, in my opinion, are psychologists and psychiatrists, because we need that professional team to deal with this applied behavioral psychology. They are abusing the use of psychology in this political agenda, and we need those professional fields to speak out in the same way that the team of doctors are speaking out tonight.
Thank you. Thank you, Piers. Thank you, Brian, so much. And again, Brian, thank you for all your effort, and the UK Column team for sponsoring this. It's now my privilege to introduce a conversation I had earlier this evening with Robert F. Kennedy, who's published a new book that is punching through the fog of war. So let's roll it. Okay, well, first of all, ladies and gentlemen, it's my pleasure to welcome to the COVID-19 Symposium for the Doctors for COVID Ethics, a man who needs no introduction here, Robert F. Kennedy, Jr., who is the chair of Children's Health Defense, a seasoned attorney, litigator, and now, well, you were a best-selling author before this, but now this is the one I want to hold up. This is The Real Anthony Fauci, Bill Gates, Big Pharma, and the Global War on Democracy and Public Health, already a global bestseller. I just read, the last time I saw you, I had not read it. I have read it, and I have to tell you, I started it on a Saturday morning, and I said, I'm just going to read a few chapters. There went the day. I spent I could not put it down. And for a book with this many footnotes to be this well written and fascinating and spellbinding is a great achievement. I have no idea how you did it, but I just want to congratulate you.
Thank you so much, Catherine. Well, you made really like coming from you. I think that's the best praise I've had coming from you. So.
Well, I keep telling people this book has more footnotes than the Encyclopedia Britannica.
Anyway, we have to be careful.
Yeah, no, it's clearly brilliantly documented. Okay, so I want to dive in this way. The session that you'll be part of tonight on Doctors for COVID Ethics is called Global Coup d'etat, and I think no one does a better job of explaining how Fauci and his role fits into the global coup. The book does a marvelous job of doing it, but I want to kind of dive into the middle, because the thing I like the most about this book is that people all over the heartland are feeding back to me and saying, oh my God, it's really this bad. And how did I not know that it was this bad? So it's a remarkable achievement, and it's sort of piercing through and breaking through the fog of war and making people realize this really is a global coup. So I want you to step back and tell us why you wrote this book and how you managed to connect the dots to really the change of control that is being attempted across the planet.
Yeah, so I felt like I was in a unique position because I'm litigating, and I apologize for my voice, which is really bad today. Hopefully it'll get better as we talk. But I felt like I was in a unique position because I've been litigating for many years against powerful corporations on environmental issues. And I had seen firsthand and really understood the dynamics of agency capture, how regulatory agencies, through a variety and abundance of very well documented forces, are inevitably captured and transformed into stock puppets of the industry that they're supposed to regulate. And the public health, so probably 20% of my lawsuits, I've got over 500 lawsuits, mainly against polluters, but probably 20% of those were against EPA and the state regulatory agencies that are supposed to function to protect Americans from pollution, but instead had become promoters and spokespeople for the and defenders of the industry. And I also, because for 17 of those years, I've been working on public health issues, and specifically with vaccines, trying to get some vaccine safety, robust science, independent regulators who are free from these corrupting entanglements with pharmaceutical companies. I also recognize that what happened in the public health arena was really unique, that there's a level, because of these financial relationships with pharma, it's become like it's regulatory capture on steroids.
Right. I would say it's regulatory ownership.
It's ownership. The relationship between pharmaceutical companies and the three big agencies, HHS agents, sub-agencies, FDA, CDC, and NIH, is a seamless subsidiary relationship.
Right.
In other words, even within those agencies, the individual regulators, the highest level people, regard their job as a partnership with pharma.
Right.
Pharma is consulted on everything. Pharma can overrule policies. You get advanced in those agencies. You get your bonuses. You get your salary increases by promoting the pharmaceutical agenda and by promoting the mercantile and commercial interests of pharmaceutical companies, and particularly vaccines. The vaccines become the fulcrum of that whole relationship. One, because they were enormously profitable. And the reason they're profitable is because they're exempt liability.
Right.
So the biggest cost of every other medicine is downstream payments to people they've injured. Every medicine injures some subgroup. And pharma is immune. You cannot, no matter how egregious their behavior, no matter how not terrible your injury, no matter how reckless or negligent their conduct, you cannot sue them. So that alone made vaccines immensely possible and profitable when that act was passed in 1986.
Right.
And you had this gold rush, which, where they added all these new vaccines. So we went from the 3 vaccines that I had as a kid to the 17 essentially mandated. They're technically recommended, but in many states, you cannot enjoy your freedoms without complying. Your kids can't go to school, etc. And to 72 doses of 16 vaccines that are mandated now from kids from birth till when they're 18 years old. And accompanying that change, beginning around 1989, when a lot of these new vaccines were suddenly recommended, you had an explosion in chronic disease, which really enriched the pharmaceutical industry. So you had, autism go from 1 in 10,000 in my generation to 1 in 34 today. You had food allergies suddenly become epidemic, peanut allergies. And, the pharma was selling the $600 EpiPens. And you had rheumatoid, all the autoimmune disease, rheumatoid arthritis, juvenile diabetes, lupus, Graves' disease, Crohn's disease, MS, all these other diseases that are, by the way, they're all listed as side effects on the manufacturer's inserts of these 72 vaccines.
Right.
They suddenly became epidemic, and vaccines went from being an $187 million a year industry when Tony Fauci took control to a $60 billion industry. Right. But the big payments to the pharmaceutical companies are the selling the remedies for the chronic diseases that are associated with the vaccines that they're selling children. Oh, treating the seizures, treating all these, 170 autoimmune diseases that suddenly became the neurodevelopmental diseases, ADD, ADHD, speech delay, sleeping disorders, tics, Tourette syndrome, narcolepsy, all these things that my generation never heard of that suddenly appeared in 1989.
So one of the things I love about this book is you do, as you're documenting Fauci's agency basically controlling and running over $750 billion from the time he takes over, you are documenting the slide in the health of Americans, their life expectancy, the chronic diseases in children, which are epidemic. And the one that really takes your breath away is from 2000 on, the IQ of American children have dropped by 7 points. Is that correct?
Yeah.
Right. And so you're showing how the disease is growing and the American people are sliding into failure.
We went from being the healthiest nation in the world to being the sickest. So we're number 79 in terms of all of the indicia of the cumulative indicia of health metrics. Oh, all the things that public health regulators use to judge whether a nation is healthy and not. The declines in longevity, life expectancy, the rises in infant mortality, and first mortality, second-year mortality, and the medical claims. Right. So we went, and ironically, again, and Fauci has a lot to do with this, we are consuming more pharmaceutical drugs than any other nation. So we consume 3 times the pharmaceutical drugs as the other Western nations. We pay higher prices for them. We have the most expensive healthcare system in the world. And we're 79th in terms of public health outcomes. And I show how most of those problems are not, you can't blame them all on Dr. Fauci, but he alone could have prevented all of them. And what he's done is he's turned NIH from a public health agency, which is a gold standard public health agency where it was when he founded, to an incubator for pharmaceutical products.
Right, but you also draw the circle out into the intelligence agencies and a broader coalition of syndicate who's engineering central control. And so it very much, if you look at the rise of inequality, it's very much a part of this because poor health is part of what's causing this rise in inequality.
Yeah, exactly. And if you look at the way, they drill this idea again and again, a pandemic response. Tony Fauci was intimately and intimately involved in figuring out well in advance of COVID-19. Here's what we do when there's a pandemic, and he worked in, I think, one of the revelations of my book shows how closely he worked with the CIA.
Right. In
developing a response that had nothing to do with public health. It was a militarized and monetized response to a public health crisis. It was in each of these pandemic simulations that they did over 20 years, they were training frontline workers, public officials in Europe, Canada, the United States, and Australia how to use pandemics as not to heal people,
right,
but as a pretense for imposing totalitarian controls, for the controlled demolition of constitutional rights in all the liberal democracies across the world. They called this pandemic the secret pandemic simulation program they had, Operation Lockstep, because it was a way of training all these governments to pivot in lockstep and impose totalitarian and as we talk about, to execute a coup d'etat against democracy globally.
So one of the things I first heard from you, and it was a very powerful, really powerful insight, because I keep trying to warn people we have to stop the vaccine passports. You pointed out they're being run by the financial ministries.
Yeah, that's right. The real danger of vaccine passports that people have to understand is we live in a country, and the Europeans, formerly lived in countries where you can pretty much do what you want. These governments are not perfect. Our constitutional rights are not perfect. There's always occasion for abuse. Government and industry have more power than we should be giving them, but it was pretty good anyway. You could go to the bowling alley, a sports game, you could get on an airplane and fly anywhere you wanted without being, tracked or traced or any of these things. And you had a lot of freedom in your lives. But once you get that passport, those freedoms are no longer freedoms, they're privileges.
Right.
And they're privileges that are contingent upon your obedience to a ultimately limitless inventory of diktats.
Right.
Many of them from unelected authorities, like 50-year bureaucrat like Tony Fauci, who, without any public hearing, can say everybody put on masks, everybody social distance. And the significance that these are not being administered by the public health agencies. One is there is no public health justification of these passports. We know that the vaccines do not prevent transmission. They cannot end a pandemic, therefore. And so there's really not a public health rationale. It is a control device. And it's a control device that is going to be linked to currency and to your checkbook, your savings account, your capacity to.
I believe they're going to use it to take all of our assets. I really do.
That's possible. I try not to predict what's going to happen that I don't know about. But here's what you can predict. I mean, we know they now have programmable currency.
Right.
What that means is that when we move to digitalized currency, which you've been warning about for years, they're going to be able, the government will then it makes every transaction that you make visible to government,
right,
and reportable, and it makes every transaction visible to these financial houses, so the government can tax them. The financial houses can figure out ways to make money from the friction of, when you buy a porn magazine, a bottle of beer, whatever it is that you're buying, they're going to know about it.
Right.
But it also allows them to stop you from spending money on things they don't want you to stop spending money on. So you can program your currency, for example. Let's say you violate a social distancing rule. And they know that because they know your location 24 hours a day from your cell phone, etc. You violate that, and for facial recognition of places, you violate that rule, or you refuse a vaccine or whatever. Now they can say, until you comply, or in punishment, you are under house arrest, and you can only leave your house to buy at local grocery stores. And they can make it so your money does not work anyplace other than a grocery store within a mile of your house. They can make it so you can't travel from Los Angeles, from Brentwood to Burbank. You can't get gasoline. You can't, so they can control you with no due process. They can simply control you. And all of these rights that we assume we have now become privileges that are contingent upon your obedience with their diktats and with your social credit scores and all the things that they can now look at are going to be slowly added. So here's the thing that I would say the ultimate punchline is that we were told this was going to only be 2 weeks. We know it's going to last forever. There is no rule, there's no power in history that governments have accumulated and given back freely. There has to be a demand.
Right.
And will keep those powers forever. They will never relinquish them. Number 2, each one of the powers they've gotten, and this is a rule that is as reliable as the rule of gravity.
Right.
They will abuse it to the ultimate extent possible. So you have to assume that any power that you give them, they are going to abuse.
Okay, so how do we push
the
back?
last rule I would say is nobody ever complied their way out of totalitarianism.
Absolutely. Bravo.
The more you behave, the worse it's going to get.
Yes,
the only
absolutely.
thing you can do is resist. And this today, this is the hill you're going to die on. Because if you do not defend this hill, you're going to be pushed back to an even worse one tomorrow.
So 2 things before we close. I have to tell you, one of the most inspiring things about this book is I realized as you read it, what you have managed to do over many decades is pull together, I call it a Zulu army of the 21st century, a group of doctors and scientists and attorneys and journalists. And it is a remarkable demonstration of what happens when that many smart people come together to serve freedom. And it's remarkable. It's really, because you've managed to put together a network which is very mighty and very inspiring and makes you feel when you read it, I'm not alone. I'm not alone. There's a lot of people who are fearless and fighting for freedom. So
I've got to run out, Catherine, but we are in an arms race. And the question is, can we build the resistance quick enough to stop the escalating control that they've got now with their turnkey totalitarianism? Or are we going to get to the point where they just have so much power, even if 100% of us are opposing them, they're going to be able to press.
So one thing I'm going to suggest, one thing everybody can do is buy this book, read this book, give it to your friends for Christmas, pass it out. I've been passing it out like candy at Halloween. And but it's remarkable because I pass it out and people read it. And when they read it, it changes their mind and they see the urgency of doing something and resisting now. So as you say, resist, resist, resist. And, I can't thank you enough for joining us. The Doctors for COVID Ethics, all of us are very appreciative of everything you do. If there's anything we can ever do to help, let us know. We're there.
Thank you, Catherine.
Have a great day.
Good stuff.
Welcome back. I'm Patrick Henningsen. I'll be moderating session 3. And the title of this session is the Temple of Justicia still standing? That is the question we're posing. And the focus of this session is going to be on the legal and court challenges directed at various government agencies, regulatory bodies, both in Europe, North America, and also further afield, but also in the area of human rights, law, and conventions. And we're pleased to welcome a fantastic panel that we have assembled here of presenters for this session. We'll be hearing from Mary Holland, Renate Holseisen, Philip Cruz, Dr. Meryl Nass, and also Dr. Astrid Stuckelberger. And first, we're going to join right now is going to be Mary Holland. Mary is currently the president of Children's Health Defense. She's also director of the graduating lawyer program at New York University School of Law. She's written several law review articles and also on the subject of vaccine law and policy, and has co-authored and co-edited a number of books, including Vaccine Epidemic, HPV Vaccine on Trial, Seeking Justice for a Generation Betrayed. And she has extensive experience in the field of advocacy for the rights of victims and medical injuries. And we'd like to welcome to this session, Mary Holland. And Mary, if you'll first, you have a statement prepared, which you'll be giving us, but we're hoping that you'll be able to enlighten us on the general legal landscape in the United States and give us the current situation. And if you can highlight also, which I think you will, some of the key events that people need to be aware of, and also hopefully, and for all the speakers for this session, what opportunities are sort of now available and what's important and what people need to focus on. But welcome, Mary Holland.
Thank you so much, Patrick. And let me just say, I am full-time at Children's Health Defense. It is a very full-time occupation. So I want to give you the viewers a little background on the legal landscape in the United States. So vaccine mandates have been permissible under state law in all 50 states for over 100 years. All 50 states have medical exemptions by federal law, and the vast majority have religious exemptions for children's mandates, which have been commonplace, and for adults. What's happening with respect to adult mandates in the United States is unprecedented. So the Biden administration in the fall came out with announcements that it would impose several different federal mandates. They announced that they would be mandating COVID shots to their own employees, which includes the military, but also to federal contracting corporations, to all entities that receive money from the federal government for the elderly and for indigent patients. So that's hospitals, nursing homes, and medical practices. And they announced that they would have a mandate for all corporations across the country with more than 100 employees. So what's happened since those announcements is rather extraordinary. And that is that lawsuits were filed against these federal mandates across the country by individuals. But most importantly, they were also filed by 26 states. The majority of US states filed lawsuits against one or more of these federal mandates. And in particular, the lawsuit by attorney generals about this 100-person corporation rule got a very decisive pushback in the Fifth Circuit Court of Appeals, so one of the regional circuits. And basically they said, no, you can't do this. There's all kinds of issues, separation of powers issues. This isn't adequately specific. And because so many lawsuits by states were being filed, there was an agreement that they would be moved, and this was a lottery, to the Sixth Circuit Court of Appeals. That's known as a conservative regional circuit. But the other two mandates too, the medical federal monies mandate and the federal contractors mandate, have also been suspended. Preliminary injunctions, which is a very high standard. In other words, they'll stop the enforcement of the law until there's a trial. They are also in place. Also, there have been lawsuits filed around the country regarding access to religious exemptions, medical exemptions, natural immunity, and challenging state authorities and governors and mayors for their use of emergency powers. And again, they're challenging this on many, many different bases. Another important dimension of these lawsuits in the United States is what standard must a court apply? Can a standard just say, low standard, kind of if there's what they call a rational basis, if there's some reason for the government to impose this, or does the government have to apply a high standard, recognizing that these are fundamental human rights? And do they have to see that the state has a compelling interest and is infringing on these fundamental rights in the least restrictive means possible? So I just want to point out a couple distinctions with Europe. First, we have judges in the country, both at the state and federal level, who've been in practice for many years. They were in the private sector. They don't come out of law school and become judges, as in civil law countries. Also, I want to point out that the US is quite different than Western Europe, because we not only have a First Amendment about free exercise of religion and speech and assembly, but we have a Second Amendment entitling people to keep guns. And we have more guns among the civilian population in this country than people. And in these circumstances, I think that is making a difference. Let me just also conclude by saying that Children's Health Defense, where I am president and also working in the legal field, we have many lawsuits going on right now, and we have lawsuits challenging the religious exemption denials, medical exemption denials, cases about emergency powers, cases related to national immunity, challenges to mandates in schools, in universities, by employers. We have lawsuits against the Food and Drug Administration for malfeasance. We have lawsuits relating to the suppression of early treatments, including ivermectin and hydroxychloroquine. We have a challenge about allowing 11-year-olds to consent without parental knowledge to COVID shots and other shots. We have cases regarding censorship against Facebook, and actually even a case now against Senator Warren, who called on Amazon to censor Robert F. Kennedy Jr.'s, or a different book, but a book in which he had put it forward. So in conclusion, I'm cautiously optimistic. I think the courts follow culture. I think the activism that people are engaged in is crucial. I think that courts slowly and methodically follow culture. And so I would encourage people to keep alive the hope for the judiciary, at least for the United States, and keep active, speak out, because the courts they are affected by what happens in culture. Thank you so much.
Thank you very much, Mary. And the last point you made, I think, is absolutely poignant, and I think we should also look at that even closer. So what you're saying, Mary, is that what happens outside the courtroom has a direct impact about the decisions made inside the courtroom, and that's not something that a lot of people will join together certainly people who
Well,
don't work in.
At least
Go
an
ahead.
indirect impact, Patrick. I don't think I can say that it has a direct impact, but courts have judges who are people too, and they are influenced by the broader conversation and the broader narrative. And when there are broader challenges like Doctors for COVID Ethics and all of you, when there are thought leaders who are challenging the narrative, it does affect the court. It absolutely does.
And also, you've throughout your career, you've also done a lot of work regarding the HPV vaccine and Gardasil. And just to tell us why this is really relevant, because there is a direct connection to what we're seeing right now.
There's a very direct connection. So Gardasil came on to the market, in a global capacity from two different, Merck and Glaxo at the end of the knots, right? 2006, 2007, but it was a global reach, all countries. Every preteen is supposed to get this, very little rationale, just like COVID shots, it doesn't prove, it was never proven to prevent cervical cancer. It was clear that there were really horrific side effects from the clinical trials, and yet they pushed it out anyway. Very lucrative. And I think there's a lot of similarities. I would argue that sort of the HPV is the precursor to what we've seen with COVID.
And also the other thing that's really disturbing, I also read that you've also touched on as well, is this idea of the CDC scheduled vaccines, especially for children. That once a vaccine gets on that schedule, then there's a lot more power that they seem to be wielding. But go ahead.
Patrick, I should have mentioned, so one of the crucial dimensions for people to understand, and this is true around the world, is the liability protection for the manufacturers, for the doctors, for the healthcare practitioners, and for the government officials. And this has been elevated to the highest possible level in the context of COVID. But it's only this liability protection that permits these programs to go forward and to allow these literally tens of thousands, hundreds of thousands of injuries to be occurring.
Yes, and I think also Dr. Meryl Nass has also done some work in this area as well, so we might have a comment later on that. But we want to thank you very much for that intervention, Mary, and hopefully we'll have more that we can talk about in a few minutes after the other speakers. But thank you so much. Mary Holland, thank you. Now, we're going to be hearing next from another legal expert. Her name is Renata Hosaisen, and she's based in South Tyrol, Italy. And Renata has experience at the Supreme Court level, the European and international law level, and is actively engaged in a number of issues, certainly regarding fundamental rights and freedoms. And so she's going to hopefully take us, guide us through the constitutional and legal landscape of what's going on right now in the European Union. And it's very relevant also to what's happening in the United Kingdom as well right now, where we're situated. But we'd like to welcome Renata to this conversation. Hello, Renata. Oh, you think you want to unmute your microphone, Renata.
Thank you for the invitation. I unfortunately have to say that we are in a very different situation, and we haven't judges like the judges in the United States who are treating these very important issues in a very objective way. We are facing, especially in Italy and in Austria and Germany, denial of justice currently. And this keeps the population in a very, very serious situation. We have in Italy the mandatory vaccination since April the 1st of this year. So we have thousands of health workers suspended from their work without salary now for months. Some even for 6 months, and they are continuing to suspend other healthcare workers, even if the healthcare system needs these healthcare workers. It is absolutely crazy what they are doing in Italy. We had, since the beginning of this year, a lot of criminal complaints, a lot of proceedings before the labor courts in Italy. But yes, at the end, all without success, because the courts are following the governmental propaganda, and they're treating this issue like an ordinary vaccination issue. So even if we lawyers are trying to and we bring all the documents and explanations in order to show that we are here speaking about experimental substances on a genetic treatment basis, and not about ordinary vaccines. With all the studies done, the judges continue always with the official narrative. Now we have some hope. Some days ago, for the first time at all, the labor court of Padua, the northern part of Italy, decided to send a preliminary ruling regarding the validity of the decision of the conditional authorizations of the four so-called COVID-19 vaccines to the European Court of Justice. So a lawyer who is also a professor in European Union law was able to convince the labor judge to send this very important preliminary ruling to the European Court of Justice. And we hope that we will have soon a success, because what we are seeing and facing in Italy as grounds of the decisions of the courts is literally scandalous. It's absolutely scandalous. They are playing with with life and health of thousands and thousands of people. Now in Italy, beginning with December the 15th, we will have the mandatory vaccination also for the teachers, also for policemen, for army members, fire workers, and so on. So we have now a huge number of persons under this pressure, and we lawyers who are in a we are still not a large number of lawyers engaged in the defense of this human rights, because we are talking about crucial human rights. We have to try to give these hundreds of thousands of people arguments in order that they can defend in the first step themselves against this aggressive military vaccination program. And what we presume is that the Italian government is planning a general mandatory vaccination, like it is already given in Austria, beginning with February the 1st. So we see that Italy, Austria, and Germany, because also in Germany they are the new government was members who we know that they are going directly to a general mandatory vaccination. We three member states are again these three states where totalism is realized, like we already had it, some years ago. We are in a very dark situation, and we hope that this preliminary ruling coming now from Italy will come to judges at the European Court level, who feel the responsibility they have, because they have to save millions of people at the end.
Yes, yes. And I wanted to get your comment, maybe a broader comment. And one thing I've noticed, that there are structural differences in terms of the law, in terms of constitutional rights, with the situation in the United States as opposed to the federal system of the European Union. And the EU might be at a comparative disadvantage, sorry, in that sense. But what we find in the United States is this crisis has basically opened the wounds of some systemic inadequacies or structural issues within government, and it's going to lead to some sort of reform, whether it be political, legislative reform. It might even go a little bit overboard. But what about in Europe? Are you coming to this same realization?
Yes, absolutely, absolutely. We have here in these conditional authorizations of these 4 COVID-19 vaccines was given by the European Commission based on a positive opinion of the EMA. And based on the European Union law, it should be possible to every citizen to go to the General European Court and ask for the annulment of this decision if this decision is illegitimate. But we have the situation that the General European Court was a decision based on grounds which are illogical, rejected the 4 actions for annulment I brought in for Italian suspended healthcare workers, declaring, for example, that the suspended healthcare workers had no interest in the annulment of the conditional authorization of these vaccines. So everybody could understand that these are grounds, arguments which are illogical. And I will recommend that that we had already 20 years ago maybe the greatest advocate general at the European Court of Justice, Sir Francis Geoffrey Jacobs, who declared already 20 years ago that if the General European Court did not admit the direct actions for annulment brought in by European citizens, where they are affected directly by decisions of the European Union organs like the European Commission, then there will be a denial of justice, and he has foreseen this development. And but we see that the interpretation also against the European Union law chosen by the General European Court is to restrict more and more the admission of direct annulment claims. And this means that at the end, we as a European Union citizens who are facing more and more decisions by the European Union organs, which have a direct impact, in this case, a very negative impact on our lives and our health, we don't have a real guarantee of justice, and this is something we have to change very rapidly, because it can't be that, like I said before, I repeat the example of the healthcare workers in Italy, that they have to bring in for months claims and open legal proceedings before a lot of courts, national courts, before finding after months, after half a year, the first judge willing to send a preliminary rule to the General Court of Justice. And the general advocate, the great general advocate Jacobs, explained also that a preliminary rule can never be the appropriate procedure for deciding for the decision regarding the validity of decisions of the organs of the European Union. It should be the direct claims for annulment, but the interpretation chosen by the court is another one. We will try to appeal, because we think we are in a situation where the European Union jurisdiction has to show that the system is made for the citizens and not for somebody else.
Yeah, and that's such a crucial point. Whether the citizens of the EU have any standing, really it comes down to that fundamental point. So hopefully we'll be able to touch on some of these issues later in a few minutes. But next, I'd like to welcome our next presenter. Philip Cruz is a Swiss attorney who's practicing in commercial and constitutional law. He's included several cases dealing with the regulatory impact on children, for instance, but also leading several important initiatives regarding the support of activists. And we're hoping that Philip will be able to take us through the legal landscape of what's happening now in Switzerland, what's really important regarding the present situation. I know the recent referendum has certainly made headlines in your country, with the vote maybe not going the way that a lot of people would have liked, but that's another conversation. You might touch on that, and also what opportunities might be presenting themselves in your country, Philip. But welcome to this session.
Thank you very much for your kind invitation. It's a great privilege for me to be here, and I gladly present the situation from the legal perspective of Switzerland. Now, I can tell you that Switzerland is leaking a little bit behind when it comes to the very strict mandatory rules regarding the general vaccination. We have no general vaccination rules applying so far, and there is so far also no public sector that is exposed to immediate general mandatory vaccination duty. But we have a very intense public discussion coming and going on, and we see here in Switzerland that literally every political move and political step was always prepared in a wide media dogmatic discussion, in an almost aggressive way of information that is only a question of time, and I would say more or less April, maybe May, until we will face this reality, political reality of political pressure of this mandatory vaccination. And now this brings me to a very first characteristic in Switzerland. We are leaking behind, and this gives this impression of, by most people, leaves the impression that in Switzerland we are still fine off if we compare with the other countries. And this is what I hear most, even from my colleagues, lawyers, when I start to criticize the very aggressive and over excessive way of imposing measures by the state. And they say, well, you should be happy. It's still much better here in Switzerland compared to the situation described by Renate Holzeisen in Italy or in Austria or in Germany. And so this might be a first answer to the question, why don't we have a strong group of lawyers, a strong group of activist lawyers that push forward with a lot of proficiency all these cases against statutory excessive way of enforcing these measures. I can tell you that this is correct. Yes, I do this since the beginning of the year. I am a tax lawyer. I was a tax lawyer, I can say, 17 years before, but that's an advantage in the situation right now because tax law is well governed by statutory rules and court practice when it comes to legal defense rights and restrictions of governmental power, the right to be heard, the rules regarding burden of proof, and most of all, the principle of legality. That means that the state actions, there are no state actions allowed outside of the rule of law. And so here, as we are a little bit leaking behind with respect to the measures, most court activities is focused against these perpetuated duty to wear masks in schools. Just to remind you, there are children the age of 10, 12, 13 that have already worn masks for many months in school. And also in this field that it's 10, 11 court cases, and already now I see a pattern that is similar to what was described by Renate. And the pattern is that the courts say that during these times of emergency, these times of crisis, we need to take the facts from the competent bodies and experts, which clearly are here from their perspective, the WHO and the National COVID-19 Task Force. And there's no reason for the courts to deviate from these expert opinions. And this is, of course, one of those points where we say there must be a state and mandatory control and an independent control by the courts, because this is a characteristic of a democracy and of a free democracy that is governed by Swiss constitution. So far in the bigger cases, also when it comes to this repetitive testing, or when it comes to the 3G, this is the green pass logic, where also here in Switzerland, we live meanwhile under this 3G logic. That means that the entire population is declared to be a risk, a high risk to everybody else, unless you prove by way of either testing, negative test, or a vaccination that you actually are not a risk. So you are forced, this coercion, you are forced into this way of doing these tests that are usually on the Swiss law only allowed to be applicable, to be applied for people that are literally sick, or in a concrete, on the concrete subsumption of being sick. And this is a logic that really does a lot of harm to students that are not allowed to enter their campus without presenting this certificate. It does a lot of harm to many industries, to the culture industry, to the entire, literally to most of the industries in the business. Today, I heard of a client whose fitness studio, this is one of the biggest in Zurich, was closed only because the client did not enforce good enough, well enough, his control to review these certificates. Then we have a little first spot of mandatory vaccination that is applied to the Swiss pilots and the cabin crew members of Swiss Airlines. You have certainly heard about it. And I have the privilege to advise them, to defend them, and they are very well organized internationally, also with other airlines. And meanwhile, it seems that with 1-2 exceptions, Swiss is meanwhile the only company that still upholds this mandate for their pilots to be vaccinated. There are tremendous issues of safety, not only of individual safety, but also of flight safety and the international flight conventions that are governed by the main principle of safety, most of all. Yes, then we also have what Mary Holland mentioned, this issue of this consent that children, meanwhile in Switzerland, are considered to have a free will and to be allowed to consent, to give their consent alone without the consent of the parents to be vaccinated. We have a very bad judgment allowing for doing so. And we all know that there's actually no valid consent in this vaccination without having full information also about the risks that are associated with this vaccination. I must say I have a very fruitful cooperation with the lawyers in Austria, also in Italy with Renate Holzeisen, helps a lot because here we are not yet a strong community of lawyers. I try always to exercise my influence on other colleagues and say there's so much to be done. And you mentioned this vote about this COVID-19 law that was a great chance for the Swiss people to give a clear signal to say no to the government and say actually no to some very detrimental provisions that are in this law. And personally, I expected that most people meanwhile understand what is at stake. It is our democracy. It is at stake literally. And the functioning of our free democracy, protecting the civil rights. And I cannot give you a final explanation why 60% of Swiss voters welcomed these changes of this law, which I'll give you just 2 examples. It enacts or seems to enact this principle of 3G by this duty of imposing this certificate. And most of all, there's one clause giving the full power to the federal government to define by themselves what are the criteria by which they measure whether we are still or not under an epidemic situation. And this is actually a very bad example of pure extra legal and extra constitutional government, because there are only very simple, clearly and well observable criteria when it comes to epidemics. And these are the over-excess number of people going to hospital or even to die, clearly established by a certain virus and not any other, let's say, mutants and new virus deviations with certain figures and certain Greek letters, alphabets, from which we all know, like this variant Omicron, there is no evidence that Omicron indeed brings harm. So if I come to my end, what we see here is more or less the same what is going on in the rest of the world. The public attention is drawn away from the clear evidence that is relevant for legal cases by massive propaganda. We don't have a variety of different information sources. We have a massive propaganda. And I would agree to what also Mary Holland says. It is so important now that we empower the ordinary citizen to get their voices heard, not only by way of a court proceeding. I try to actually to help people to help themselves to get their voices heard in schools or vis-a-vis communities or even with the cantonal government, because their voices must be strengthened. And hopefully at a certain point in time, we must reach the arena of public attention and of public information. And this is also one of my motives why I do these legal proceedings, because they can also serve as a platform to get the message heard and to present the legally relevant facts. Yes, so we must keep our co-citizens active. The burden cannot be done only by the lawyers. We must have the courage to speak out, to say no. And we have to do it in schools, in the community, because it can have an impact. I'm convinced it will have an impact. And as lawyers, we need to continue to work with the courts and to give them a very hard time to deny us the civil rights. And yeah, this is what I want to say. Thank you for
Thank you, Philip. I want to ask you one question, Philip, and in the interest of time, if you could just give me a brief answer, and of course we can continue you can continue your thoughts later, hopefully at the end when we have a brief roundtable discussion. But just quickly, you know, what's allowing governments in so many different countries to work outside of the rule of law is they are depending on working through businesses. In other words, using the business community as a proxy, or rather by fiat. Or institutions like schools. And in the United States, this has been done by the Biden administration very artfully by not actually going through his executive branch, but via a federal agency. And this is allowing governments all over the world to do things and to push policies that they would not be able to do directly because, in fact, they're prohibited from doing that. Is this a situation that you're seeing happening in Switzerland?
Well, that might be also the case in Switzerland. But I would add another explanation as well. Here in Switzerland, if you look back the history in the last 200 years, people can say our government did all the time everything right. Look around. Everything is so neat and tidy. And we never had a war. We never had to defend democracy with blood. And so there is a belief that the government, the Swiss government, is always right. And people cannot imagine that meanwhile, there are so strong reasons to really oppose the government. Then another point is people here in Switzerland, they live on a very, very high level of wealth. So if you oppose too much in these times, you risk of losing your job. You risk of being put aside from the society. And this is not a nice feeling. So I think these two elements are certainly for Switzerland two additional reasons why it is easy for the government, in combination with the media, to push through their agenda.
Thank you very much. Thank you, Philip. And hopefully we'll be able to pick up on some of those points later in a few minutes. And next, I would like to welcome the next presenter, Dr. Meryl Nass. And she's an internist with a special interest in vaccine-induced illnesses, including chronic fatigue. She's worked with Gulf War syndrome, fibromyalgia, toxicology, and she's also a biological warfare epidemiologist, and she's played a key role in helping veterans, for instance, who have suffered via the anthrax vaccine program. So I'd like to welcome right now Dr. Nass, and hopefully she'll be able to tell us, she's done a lot of work regarding the FDA, the CDC, and working to communicate with these agencies through her investigation. She's a unique combination of an investigator and she is also a physician as well. So she's well placed to get to the bottom of some of these issues. But welcome, Dr. Meryl Nass.
Thank you, Pat. So I have a PowerPoint. Is that coming up?
Yes, indeed.
Thanks. I am going to use the example of myocarditis to show how the federal agencies that are supposed to be helping the public health are hiding information from us And if we had this information, we would not be in the situation we find ourselves. I mean, it's so clear, at least to me, that the vaccines are dangerous, but we are not able to see the evidence. So the best thing these federal agencies could have done would be to have not collected information, not done surveillance. But unfortunately, they told us they were going to do the best surveillance ever. They're going to collect more data than had ever been done before to show us the safety of these COVID vaccines. And 1 year ago today, there was a meeting, and this was at the FDA. This woman was the head of vaccines at CDC at the time, and she listed all these different databases. Every one of these icons is a different database that CDC said they were going to be using to evaluate safety of COVID vaccines. VSafe was a new thing that was, are you seeing the, I'm sorry, we're on the third slide.
Okay, yes, we're here.
Okay. VSafe was set up as a cell phone app, and many people were asked to put it on their phones. What VSafe showed us in the first month of the vaccination program was that about 1 to 3% of people who were vaccinated required a visit to a doctor or to an emergency room afterward. We've not really heard much from VSafe since then. VAERS, of course, is the one database in the United States that must be made public. This was enshrined in the 1986 Childhood Injury Act. And so people do have access to VAERS, but the CDC and FDA have very surprisingly been ignoring the incredible amount of data in that vaccine adverse event reporting system, which they jointly run, which has showed us that there are more deaths reported to VAERS now for these COVID vaccines in 10 months than have ever been reported for all vaccines in the United States over 30 years. So cumulative deaths to this system did not add up to the deaths reported related to COVID vaccines into 2021. Apparently, it looks like these three databases are underneath VAERS are being pushed into the VAERS system, but we don't know that for sure. They don't explain it. To the right, in this blue box, there are databases that CDC said it didn't have online at the beginning of the program, but it would be bringing in. And by now, they should all have been brought in. So the VSD is supposedly an active surveillance system database comprised of about the medical records of 12 million Americans who belong to several HMOs. The Genesis database comes from a nursing home company that has contracts with about 250 nursing homes in the United States and would be ideal for looking at post-vaccination deaths. Of course, we've heard nothing about that. The VA electronic health record and data warehouse also has information on about 2.3% of Americans who are veterans. And we hear very little about that. Actually, we just got a very useful study done by VA scientists, but not by CDC or FDA, regarding vaccine efficacy. And they showed that the vaccine efficacy overall was less than 50% by September. These three data systems that are supposed to belong to the FDA, the first one is federal partners, whatever that means. The second is their BEST system, which is a collection I'll show you in a sec. And the third is PRISM, and we hear nothing about PRISM and very little from BEST. This DoD Defense Medical Surveillance System database was set up after the Gulf War and was supposed to make public its data. It's a potentially very rich database. Everyone in the military is in it. Every medical visit to a military hospital or a clinic, every vaccine, every deployment is in this database. We never see it. Next slide. FDA has its own different surveillance systems it claimed to be using for these vaccines. All of these comprise the BEST system. They were all brought online this year. again, we get very, very little information, if any, from these. We don't know how they are analyzed. We don't know what the quality of the information is. We don't know actually what information these systems contain. Next slide is the working list, or is it failures to collect?
This is the working list.
Thanks. Okay, so in June, the FDA said these were the diagnoses that it particularly was trying to study. And of course, we're very interested in them. We want to know about myocarditis, thromboses, Guillain-Barré, Bell's palsy, etc. Of course, we hear pulmonary emboli, which Steve Kirsch has shown is occurring at something like 100 times the normal rate of reporting in VAERS. But we hear very little. And these are the ones they're focused on. Next slide. In the vaccine trials, the manufacturers made certain not to collect the most useful information, which was regarding the long-term side effects in people and the more serious side effects. They got a lot of detail about the short-term temporary side effects. They in their reports to the FDA, and FDA, of course, is complicit in all this. They can't do anything unless the FDA approves it. They identified adverse reactions by organ system instead of diagnosis. So you couldn't tell the difference between a headache and a paralysis. And then the manufacturers offered vaccine to all of the members in the control groups at 2 months, and a median of 2 months after they were fully vaccinated, which obscured the long-term data and has completely ruined the collection of safety data. Next slide. They couldn't hide myocarditis. They've hidden almost all the other side effects from the public. But myocarditis, and it was first identified in the United States by a scientist at Oracle who told the US federal agencies about it, and they kept quiet. But then Israel, the word got out in Israel. It was on TV. There was a lot of discussion. It was in the newspapers. And slowly the story of myocarditis slipped across the ocean, came to the United States. And 2 months after it was first reported in Israel, the FDA and CDC were having meetings about it. CDC called a special emergency meeting in June 19th to discuss this new problem of myocarditis that they'd known about for months. And then they canceled the meeting because there was a new holiday called Juneteenth in the United States. Then they had a meeting later and sort of downplayed it. The reason they couldn't hide this, because it occurs almost always within 4 days of a shot and sometimes on the same day. Usually the second shot, sometimes, especially in people who've had the illness before, after the first shot, 80% after the second shot. It's most common in teenagers, and we have no idea about how much of this very serious side effect occurs in the 5 to 11-year-olds. We also don't know about subclinical cases, and I'm going to tell you a bit more about that later. Although CDC says that it's a minor condition and 75% of the kids with this condition are completely better at 3 months, it's not that simple. If you have a diagnosed case, you're not supposed to get any exercise. Probably many sudden deaths are caused by arrhythmias due to myocarditis. And certainly in the pre-COVID era, a lot of people who developed viral myocarditis did require heart transplants or had a significant decrease in their capacity to pump blood. Next slide. This is data from VAERS, and if you look at the 1 week after the second shot, you'll find that in the first 2 million 12 to 17-year-old males who were vaccinated, the observed number of cases was 128 when they only expected between 0 and 4. So the effect size was so great they could not hide it. And if you graph the cases, you will see, and these are VAERS reports per million people who were vaccinated, you'll see that the younger you are, the more likely you are to have a case of myocarditis reported to VAERS. And the reporting rate is over 100 times higher in the 12 to 17-year-olds as in the over 50s. Next slide. Now, this is CDC's analysis of the VSD, the Vaccine Safety Data Link, their HMO database of 12 million people. And they had a look at this in June. Of course, remember, they had only started vaccinating kids under 16 4 weeks earlier. And looky here, no signal. They didn't think the incidence of myocarditis was any higher than what happened without vaccination. Now, how did they do that? Well, one way was they threw all the age groups together. The second thing they did was to throw both genders together. And the third thing they did that we know about was they used various mathematical adjustments, but they don't tell us what they are. And those adjustments most likely reduced the risk further. No matter what they looked for, whether they looked for heart attacks, appendicitis, Bell's palsy, blood clots, Guillain-Barré, they couldn't find anything, absolutely nothing. Now, we know that's ridiculous. We know myocarditis is happening, 25 or 50 times more often in young males than expected in the window of time after vaccination. And we know a lot of these other things are happening more commonly. So there is something wrong either with the data itself or with the analysis, or perhaps both. And yet CDC presents this as if it's science. Now, this is an interesting paper that is just coming out. It's been accepted for publication in Clinical Infectious Diseases, an Oxford journal. It's from Hong Kong. In Hong Kong, they looked at myocarditis cases in boys aged 12 to 17 who had been vaccinated and found 1 in 2,700 boys had a clinical case of myocarditis after the second shot. So in the graph I showed you before, VAERS reports, the reports were as frequent as 1 in 18,000, but here you can see more than 6 times greater when you start really looking for cases. Now, let me jump to some science that was done on myocarditis after smallpox vaccine. So normally, when you're performing active surveillance, you're still just waiting for cases to show up in a database. You're looking hopefully at all medical visits, but you're not actually going after people who got the vaccine and testing them in any way for the diagnosis. In this case, the military, knowing that smallpox vaccine could cause myocarditis and knowing there was a prior report in military recruits from Finland showing there were EKG changes in 1 in 30 recruits after they got a smallpox vaccine, the US at Walter Reed did a study. They had over 1,000 soldiers, men and women. They gave them smallpox vaccine and they drew blood on them before and after to see whether cardiac enzymes were elevated. And they found more than 200 times higher than expected myocarditis. So when they actually looked at these people, they found they had 1 in 220 had an actual case of myocarditis. They had blood that changed, they had chest pain, they had other signs of myocarditis, clear case. So not 1 in 2,700, not 1 in 18,000, but 1 in 220. And when they looked for subclinical cases, these were the ones without chest pain, but with elevation of cardiac enzymes to at least twice the upper limit of normal from a normal beforehand. They found 1 in 30 of the soldiers, 1 in 30 had evidence of cardiac damage. Now, this is smallpox vaccine. That study hasn't been done for COVID, but we may see something similar. All right. Here is another method for analyzing good data to make sure you don't find anything. This method is called PRR, or proportional reporting rate. It's an algorithm that can be used to compare 2 vaccines to each other. It has no business being used to identify whether there's a problem in one vaccine the way it's being used today. in January of this year, the CDC published a little pamphlet, which it was not circulating. And it said, we're going to use this algorithm, this equation, to evaluate the safety of COVID vaccines. And by so doing, you are comparing the relative rate of a particular reaction, let's say myocarditis. So let's say that there are 1,000 reports of myocarditis to VAERS, and there's a total 10,000 reports for COVID vaccine of all adverse effects. And you're comparing that to another vaccine for which there's only 10 reports to VAERS, and one of them was for myocarditis. If you use this equation, the two vaccines look identical, and you do not see a safety signal for the first vaccine, for which there were 1,000 reports of myocarditis. I want to emphasize, read the Substack article by Matthew Crawford that I have at the bottom of this slide. It's a very fascinating, very important article, and I think it could help the lawyers prosecute cases on the basis of this basically fake science that is being used. Next slide. The audacity, shamelessness, and deliberate confusion that is being sowed by government officials has slowed us activists down for far too long. What do we need to do to smoke them out and take them to task? Do we really have to unearth every single dirty trick that they use? Haven't we identified enough already? Surely a pattern of malfeasance can be established. How can the lawyers, doctors, and scientists strategize together to identify potentially winning legal methods to approach what is clearly malfeasance? Thank you very much.
Thank you very much. One thing I wanted to ask you, Dr. Nass, while we're here, the emergency use authorization. This has kind of become a mechanism and for a number of things. One of them is to potentially shield the manufacturers from liability under this auspices of a crisis or an emergency use authorization. So are we seeing a coordinated strategy between the use of the emergency use authorization and, let's say, also the demonization in the media of various ways to treat COVID, early treatment, and so forth? And it's created this kind of shield or a wall that really gives complete impunity within that domain of whatever range of, you could say, experimental vaccines under this emergency use authorization. But it seems to be a coordinated mechanism.
Yes, so I don't know how things work in Europe, but in the United States, as long as you are dealing with a product under EUA, nobody can get sued. So those products could be ventilators, they could be drugs and vaccines, they could be masks, they could be tests. They all have EUAs. And so the authorities who have been, I'm sure, I'm guessing, but I'm sure, have been told by federal officials that as long that they are shielded by their work with these products, because no one who develops a program, who manufactures them, who transports them, who owns the building in which you get your vaccine, nobody can basically be sued for anything under the emergency use authorization, which is under the PrEP Act. And so I think, for example, local officials who have been vaccinating children down to the age of 12 without parental consent, which is against the law in most of the states in which this is going on, have probably been told because they're using an EUA vaccine, they are shielded. But however, there is malfeasance, right? They know it's against the state law. And we haven't, the bar to suing under the PrEP Act is you have to prove willful misconduct. You have to prove that people knew ahead of time that what they were doing was wrong, that they were shipping out a bad vaccine, or they were vaccinating kids against the law or something. But I think, and you have to, it's very complicated. You have to get the approval of the Secretary of HHS, which is, obviously on its face, very unlikely. But I think to show another judge that the bar is so great that it can never be met means that the PrEP Act does not meet the standard. It doesn't give people due process. It denies them other rights. And so I think, I'm not a lawyer, but maybe we can go after all this on the basis that there is no remedy, given this massive liability protection.
Yes, that's a key point that's holding this crisis together, it seems, and creating a lot of work for people like you and your colleagues as well. But thank you very much, Dr. Meryl Nass. And next, we're going to be speaking with Astrid Stuckelberger. She's an international health science expert, also conducting research and epidemiological studies in science for policymakers. She's working alongside the United Nations, the European Commission, governments, and also the corporate and private sector. And she's also been 25 years as a member of the Faculty of Medicine at the University of Geneva and Lausanne in Switzerland. She's also published 12 books and contributed to several books and publications for the WHO, but also papers and books for the EU and also UN reports. And she's hopefully going to give us a brief overview of the role in which these institutions that I've just mentioned are playing in this crisis, specifically the WHO, but not limited to that. But with that, I want to welcome Astrid Stuckelberger. Thank you very much for joining us.
Thank you, Patrick. Thank you for inviting me. I would be very happy to take two of the topics that cross everybody's statement. And the first one is on ethics, the science of ethics in a research. I've been privileged to do international research, also population health research, which is going on now, and also clinical research. And I participated to something called the case book of ethical issues in international research from WHO. And I was author, but on second page, and funded it with the University of Geneva. So that's the first part. And then I will link that with the WHO and the international health regulation. I like my books, it's my PowerPoint. And this is actually very important for lawyers. I have talked already with Philippe about it and with Rainer Filmisch. This is an obligation for national states and member states to obey to this national security law for a peaceful world. So I'll talk about that later. First, I want to come to and support what Meryl said now, and what I can see now as, on a public health level, but also as at clinical level, like Meryl showed, we are seeing, and it is proven, we have evidence, it's a systematic scientific fraud and breach on ethics. Because in fact, normally a research always has ethics, and science is governed by ethics, like the Convention of Oviedo, of biomedical issues of Oviedo, or the Declaration of Helsinki, or Belmont, or the Code of Nuremberg, which is also a bioethic command, very important document. So when you look at it very quickly, there are two ways to see it. First is to go systematically from what happened as a pandemic expert epidemiologist. I worked for 4 years with WHO on pandemic preparedness plan. And I can tell you, so if I take my graphic in my head, first fraud, we never found the case zero. Normally, when you start an epidemic, you want to know where it started exactly. Was it a pig in a farm and a child died and it is there? Is it a monkey here? Is it a pangolin in the market of China, which they tried to make us believe? We never found the case zero. We think it is in 2019, but we don't know. It was even in the military Olympic Games in Wuhan already detected. That's number one. Second, isolation of the agent. Detection, isolation of what is causing a disease. And for that, you have to do the postulate of Koch, and this is known by everybody. You should isolate, purify the virus if it is a virus, and you should see if this virus creates exactly the same symptoms each time you put it back. Every country should do it. It might not be the same, etc., etc. But in IHR, in the WHO, there are 4 types of agents that can cause diseases. One is infection, and that's what we all think, but we're not sure because the virus has never been isolated, and some people even question it is a virus. And I'm coming to that. The second is a foodborne disease. The third is a chemical agent. For chemical agent, doctors are not competent enough. They need to go and get experts. And in WHO, there was Gutschmidt. He was the expert on chemical hazards, and I was inviting him in my sessions on the summer school of the University of Geneva on epidemics. And the fourth one is radionuclear, and you need experts on radiation. And the experts are in the International Energy Atomic Agency. And nobody has studied that. And now people are suspecting and have found some radiation. Others have found graphene, metal, and this in the vaccine. So you see what I mean? If you look at something very carefully, you go and look at every hazard, everything, and you look at it carefully. So we go down. No isolation of the virus. So how do we know what we're measuring? A test. Who has done this test? Has anybody validated this? Where does it come from? Is it really a test? And that was the first case that Rainer Füllmich attacked. He said their PCR is not valid. True. Nobody has validated it internationally. It is only a research device. It is absolutely not a diagnosis test that we use in any, even it has been confronted with HIV. So now you see you go down the fraud. The PCR has allowed all the measures to go on in the world and to say, statistically, fraud in statistics, that we have cases and the cases are disease or are contagious people that are healthy but contagious. So again, a fraud. And then WHO has taken this together and has declared an emergency, a public health emergency of international concern under IHR. So this is already the first part of the fraud, but it's not finished, because under international health regulation, you normally, like in SARS-CoV-1, there were 26 countries were touched. It took 8 months. There were 700 deaths and 8,000 sick people, and it was over. And they said, it's over. It's over. So you never go with the pandemic for ages. You always look at the curve. There is no death. It's not serious. It is not unknown. It is a threat to international trade, and never this should happen under IHR. And it should never happen that you close down everything. So what we're seeing is exactly the opposite of this international health regulation. Not only the scientific fraud, but I'm clicking it with the international health regulation because they have used the ignorance of people on research and on ethics of research and have put it together, changed words, changed definitions, and now I'm getting on the conceptual level. They have changed definition of pandemic. Normally you should not even use it. They said any disease that crosses the border, when normally it is an unusual disease that happens with a high rate of death or sick people of that disease, exactly that one. And you have to have for that autopsies, and autopsies have been forbidden. So you see that the definition of pandemic was done with absolutely no reason. There is no, I don't know how they managed to get to these changes of definition, and that's just one of them. The second one is the immunity, that you forget natural immunity and you only have herd immunity, and you change herd immunity. There is no memory. You just go and say the only memory is vaccination. Okay, you know that maybe all, and it was mentioned here. So when they change definitions of health workers, a doctor doesn't matter anymore. It's a health worker, so everybody can do the vaccination experimentally. So the procedures changed also, because when you change the definition, you can change the procedure, and then you can change the control and quality control. And this is where everything went wrong. This PCR test, even in labs, has to be done each time. I question them, and they have not done the quality control on the device, and it is limited. You cannot control anything. You don't see any bacteria, anything. So to go quickly on this fraud, the words are also very important because they use the word emergency all the time. There is no emergency, and they keep on. Which police can help to say, stop? You know, when somebody lies in a family, you just tell them, stop lying. But in the United Nations, when a WHO uses the word emergency every day and panic and make fear, which is against the international. You should not create fear. Even in Switzerland, it is a criminal law if you make fear. Article 253, I even know it by heart. If you make fear, you're a criminal. You cannot, for no reason, make fear. So the statistics are wrong. The diseases are wrong. And now they admit there was no more deaths in 2020 than the other years, even in the hospital of Geneva. So now we come to the fraud with the UN. The UN, so international health regulation was done after the SRAS-CoV-1 on 2003, 2004. At that point, Switzerland had joined the United Nations. And what happened then is that this IHR became the cursor, the backbone of everything that's going on now. And it has gone to the extent that Gavi, the Global Alliance of Vaccine, Alliance and Immunization, they changed his name a few times, has entered into force at the moment where we were teaching the implementation of this international health regulation and took over the agenda of vaccine. And this is unprecedented in WHO, never. I've been working there in and on, with ethics, with aging, with pandemic, and I never understood that there was so much push as from the moment when Gavi joined the UN as an international organization and under a special Swiss Act host of 2009, special status given to an international organization, Gavi, first one. Now all his friends came into it, and now they have just built in 2018, inaugurated by the Swiss Confederation, and I'm sure Philip can say something about it, a global health campus with a huge building, secured like police, no, like a bank. It's better. And through this agreement, nobody can come in. If there is a dead body in the cupboard, nobody can come in. They cannot take their computer. The police cannot get in the building. They can have diplomatic, carriage, suitcase, take anything in their suitcase, free organs, I don't know what. It's really terrible to see that. So if you see that IHR has become, and WHO became the game of Gavi, that they made a global plan of action from 2012 to 2020 under the World Health Assembly, and that what they are doing now, that triggered every country in the world under authorization, and the federation or the heads of state were the only one competent to deal with that. I think they have managed to put that together, at least in Switzerland and many other countries like Quebec, where I also help. So this is a very important, because how can you obligate a vaccine that is an experiment and a research? There is a breach between research, ethics, and the authorization. Nobody looked at that. Total conflict of interest. They had not respect. Data privacy, totally breaching that. Methodology, totally biased. Informed consent, completely fraudulent. It's forced, it's harassment, it's extortion of consent. In a research, you never do that. And finally, it is actually a bioweapon. That is Merrill, Dr. Merrill from the military of US has said the word, because it is forced in such a manner that we are now analyzing through electronic microscopes and many 10 different microscopes. There is something in there that's not acceptable and has not been disclosed. So the last thing I want to say is that under this, what is happening, and I ask lawyers to take care of this, because now we're reaching an international level where it has to stop from the top down. But who is going to stop them? Well, now there is an excuse to stop them. There is this guide, guide of pandemic treaty, was discussed last week in WHO, or 10 days ago, the 75th World Assembly of WHO, normally in May, and it's an extraordinary World Health Assembly. And in that, they want to do a treaty where the constitution of WHO, because out of all the agencies of the United Nations, I think WHO is the only one to have a constitution of 1948. And the Article 3921 is putting together the fact that member states belong to the constitution. And this is where I see a plan that can maybe be dismantled. This member state status is no longer a member state. Switzerland is registers as a corporation and enterprise at the European Union since 1993, and secondly, in 2014, like every state in the world, I think. I have looked, and there are many member states. So WHO, with this treaty, is deciding that the WHO constitution will have Gavi and his friends and any other type of people who can take and handle a pandemic, and the member states which lose their constitution because WHO has a constitution. I'm doing it short because I asked lawyers to go and see the last articles of this horrible paper. But this is where we are today, and I'm very passionate to be with lawyers and help to make. I have made 4 reports with data, really with complete scientific reference on what I'm saying. So that's where I am. So we have a lot of work, but I feel that it is very weak what they're doing, and we have to stop them now. And Russia, or an NGO in Russia, has said, we don't agree with this treaty, because between the treaty and the ratification, we have time to say stop. Once the ratification is done, they are planning on August, we can say stop. We have to say stop. Okay, that's my emergency word.
Thank you very much, Astrid. We really appreciate your contribution there. Astrid Stockelberger, you can also check out her work as well on the various platforms where she's talking and contributing. Look, in the interest of time, we were going to have a roundtable discussion, but we've gone over our allocation. So I just want to give everybody, if you could just give me 1 or just 2 minutes, very brief. I want to go through our speakers who have stayed on for this session, just to give us what you think are what is your highest priority right now in terms of what you're working on and what you want to achieve. And first, I want to go to Renata first, and if you could just share that with us, and do keep it brief in the interest of time, but go ahead. You want to unmute, I believe. There you go.
We as lawyers have to inform, and to give measures directly to the citizens in order that they can help themselves, because we aren't able, as we're a small number of lawyers, to help everybody with proceedings. And as my dear colleague Philip said, the consciousness of the citizens has to increase rapidly, because only if a larger number of citizens will become active, we are able to stop this. And I see a crucial role in this, especially also for us lawyers. And of course, I hope that also a lot of judges will wake up and will be aware of their very great responsibility who they have, and they have now to act right now. Afterwards, it will be too late.
Yes, absolutely. Thank you very much, Renata. We really appreciate that. And over to Philip. Philip, your final words on what you think is the area that you're focusing on. What is the highest priority right now? Oh, each one to unmute first, please. Thank you.
Yes, thank you very much for this final opportunity, and thank you also for Renata for her words, which I completely agree. This is also one of my first priorities already for quite a while, to inform people and to empower citizens. In addition, also, we try also to directly, or as lawyers, we should try to use our trials as a platform to inform the public. And we might also think of using maybe even more aggressive ways of reaching the public. And here I'm talking about, if we really see people using tools of malfeasance, like speaking in public, things like, it is because of the unvaccinated that now the vaccinated people are dying, then I must say I feel the call to actually file a criminal suit against these politicians and say, look, you are doing a lot of harm to the society. If we continue to go down this road, we will end up in civil war, because there are people who literally think that the unvaccinated people kill literally the others. So I think we have really to start using also more sharp weapons, legal weapons, and yeah, also then finally go after the bigger organizations, which so far I was only able to follow in theory what from experts like Astrid Strickelberger, who have done such a great work of research. And I really feel the need to go after these criminals in these international organizations, because Switzerland shall never be a platform for criminal organizations. This is not in line with our constitution.
Thank you very much. Thank you very much, Philip Cruz. And Meryl Nass, your final words on this and any other issues that you wanted to nail into place at the end of this session.
Well, I think the ultimate battle right now is between freedom and totalitarianism. And all the words that people throw around, right, left, Marxist, socialist, libertarian, really don't have that much meaning. The ways they were used previously, that is not relevant to this battle. I think people from all different belief systems can come together, and we need to come together and realize that what divided us before is meaningless. We're fighting an existential battle for freedom of the human race. And that's what we need to be talking about, and leave these other terms behind, and realize that, the other people in the world are our brothers and sisters, except for a very tiny minority. Thanks.
Thank you very much, Meryl. Thank you. And finally, if you could share your final thoughts. I know you just spoke just a few minutes ago, Astrid, but just briefly, what is in your mind the number one priority, the number one focus for you right now?
Save more children, save more families, and also, like Philippe said, to bring peace, because I can see the fight at Christmas can happen. And I call for, those who are falling because they have been vaccinated, we have to have compassion for each other, and we're all in the same boat together against one enemy. We're not enemies of each other. So that's very important. And save children. Don't touch children, like Mary Holland said.
Thank you very much. Yeah, Mary unfortunately couldn't stay on for the duration of this session, but of course we can point to Children's Health Defense. She's written some excellent articles, and she's doing some incredible work there as well. And I just want to also thank everybody who's contributed to this session, Renata Holseisen and Philip Cruz, Dr. Meryl Nass, and Astrid Stockelberger. Thank you, everybody, for joining us for this third session. We appreciate your contributions for this and the work you're doing going forward.
Thank you.
Thank you very much, Patrick.
For organizing.
It was a pleasure. Thank you very much.
Thank you. And we'll be taking a short break, and we'll be resuming just after a few minutes. So we'll give you time to reorient yourselves if you're watching us on the live stream. Hopefully you'll be able to join us for the remainder of the symposium. Thank you very much.
Okay, so this concludes a really remarkable symposium. We have run the gamut from medicine to political aspects and propaganda and to the law. And I think we have really affirmed the view that firstly, the vaccines don't work, right? As Suchara told us in the very beginning, for fundamental reasons, we had to know the vaccines wouldn't work and they would be dangerous. Meryl filled us in on the shenanigans, on the deception, on the scientific fraud that the US government and in fact all the health authorities all over the world are committing in order to hide the fact that the vaccines are dangerous and that they are killing people from the public. But we have seen clear evidence in honest talk that this lie can no longer be maintained. It is completely unsupportable, right? These 15 pieces, these 15 autopsies, they carry more weight of evidence than any number of statistical fabrications put out by the governments of the world, okay? Now, we also see that in addition to the scientific fraud, the continued killing of people and the continued abuse of people is enabled by the regulatory capture of the court system, of just about anything else, but the courts are particularly crucial because this would be the recourse of people to stand up and fight back against it, to assert their rights to bodily autonomy and to freedom and so on, and the courts have clearly been captured. There is value, as we have heard, in the continuing legal fight, right? If only to help raise public awareness that we live in extraordinary times, that indeed the legal system does not function, it does not protect us, and that we need to resort to other means in order to defend ourselves, right? Now, what is holding us back? And it is still a limited awareness of the world public, right? Many people are waking up, increasing numbers of people are waking up, but then on the other hand, the pressure on us is also heating up. So we need to up our game and we need to make more people aware of what is going on. And as we heard in the second session, everybody who is aware needs to step up and needs to help reach those people in the middle who may be sensing that something is wrong, but who do not have a clear picture of what is really going on and don't have a clear understanding of the urgency of the situation. Okay. So with that, I would actually like to conclude. Just brief thanks from me to everybody who participated and contributed, and I will hand it over to Sucharit to wrap it up entirely. Thank you.
Michael, excellently said. This symposium has been dedicated to the sounding of a triple call, a call for humanity, a call for freedom, and a call for justice. The call for humanity is addressed to physicians around the globe. They, you, our colleagues, have played central roles in conjuring up and driving the COVID-19 narrative along its fatal path. Return to your pledged duties to serve humanity. Recall the oath of Hippocrates and the Declaration of Geneva, 1954. Avoid doing harm. Physicians who participate in the vaccination program, search for the truth in your souls. Are you acting out of true conviction? Have you ever attempted to weigh out the evidence for and against the administration of the gene-based agents? Early in the vaccination campaign, you may have believed that injecting gene-based COVID products served the best interests of your patients. But this symposium has irrefutably documented that that stance is no longer available. The potential of the so-called vaccines to trigger self-destruction and death is now revealed. Continuance of their application is equatable with intended infliction of bodily harm on your patients. You, medical professionals of the world, must and can stop this immediately. Can you bear the thought that your next injection could wipe out the hopes and happiness of an innocent child? Blood that you may have on your hands can still be washed off, but new blood will remain on you until the day of judgment. Physicians, we call upon you to decline to participate in the harm of your patients. Resist the hijacking of medicine by politics and take patient care and patient safety back into your own hands. Follow the oath of Hippocrates. Our call for freedom is addressed to the governmental bodies and medicinal agencies whose conflicts of interest unfortunately abound. We charge them with usurping their powers in order to serve their own interests. They have inflicted untold suffering on the world populace. Cynically, mercilessly, remorselessly. The first individuals we are now addressing are the medical doctors, Anthony Fauci, Ursula von der Leyen, the Austrian and German Ministries of Health, the next president of Switzerland. All medical doctors, do you not fear that your names will go down in history alongside with the names of the greatest evildoers of all times, and forever mar the standing and prestige of our once honored profession? We challenge you to come forth and debate the matter with us in an open and honest fashion. We challenge all medical institutions that continue to laud the merits of COVID vaccination. Colleagues, we cannot both be right. And it is our implicit duty to now come together and seek the truth. Come, colleagues, convince the world of your honorable stance by accepting our challenge. We await you anytime, any day, anywhere in this world. Our call for justice is addressed to the law courts of the world. Pleas for help are reaching you from around the globe. Return to your judicial responsibility to protect and stand by the populace that is being terrorized by a select few of the world. Recall your professional duties and maintain the ethics of your profession. Open your eyes, open your ears, and open your minds to both of the opposing parties and ensure that the guilty are brought to justice. And finally, to our fellow members of the human family. We call upon you to stand up for your rights and the rights of those you love, your freedom, your bodily autonomy, your right to live, to speak, to move, to work freely without medical coercion, intimidation, or fear of reprisal. Because once you give those rights away, they will never, ever be returned. You will be sentencing your children and the generations to come to an existence in a world of darkness and horror, to a life devoid of empathy, of love, of humanity, a life no longer worth living.